Everything to God in prayer. Have we trials and temptations? Is there trouble anywhere? Jesus will never be discouraged. Take it to the Lord in prayer. Can we find a friend so faithful, who will all our sorrow share? Jesus knows every weakness. Take it to the Lord in prayer. Are we weak and heavy laden, cumbered with a load of care? Precious Savior, still a refuge. Take it to the Lord in prayer. Do thy friends despise, forsake thee? Take it to the Lord in prayer. In his arms he'll take and shield thee. Thou will find a solace there. Amen. We're going to ask Nelson to come forward and do the opening prayer, and then I do the welcome.
Let us pray. Oh, Father and our God, we give thee thanks for your love. We give thee thanks for your blessings. We give thee thanks for the delicious lunch that we had. We give thee thanks for the service this morning. As we're about to begin this portion of our program for today, dear Father, we invite your Holy Spirit to be with us. Be with the participants, dear Father. Use them, dear Father, to inform us and to infill us with the information that will help us to be more conscious about what is going on and what is amongst us, dear Father. Help us to love and serve thee and to do your will. And may your love abide with us, we pray in your name. Amen.
So, good evening, everybody. It's afternoon, though. It's 3 o'clock. You know, this morning we had a wonderful time looking at Bible principles in mental health, right? Studies have shown that since COVID, mental illnesses, what happened? There's a surge. And I'm very grateful this evening that you're here with us. And we have our guest speakers coming from far and near. I think the farthest one is from San Antonio, Dr. Dorcas. She was so gracious to drive all the way. Actually, she said yes. We just asked her a couple of days ago. Anthony asked her. And she's a woman of God, Seventh-day Adventist psychiatrist from San Antonio. And she decided to drive down just to grace our presence and to teach us a little bit about anxiety and other psychiatric illnesses that we are encountering. You know, we know that without healthy minds, healthy emotions, then we cannot be physically or spiritually healthy. And that is the reason for this program this evening. I see quite a few guests. I see Sister Job from Edinburgh Church. I want to welcome you here. I see my friend who was at our last seminar just in front of Sister Job. I don't remember her name. You, yes. I want to welcome you. And I want to welcome our friends from the Far Church. I want to welcome Olga and her family. And all of you that have decided to come this evening to learn a little bit about mental health and mental wellness. We want to stay mentally well and holistically well. So I want to welcome all of you. So some of the topics, I think you have a program in your hands. Some of the topics we're going to be looking at acute stress. And I'm sure we all have endured acute stress. Then I will introduce the speakers as they speak. So the first person up is going to be our very own Anthony. I want to talk a little bit about Anthony while he gets ready. Anthony has been a nurse for over 15 years. 7 of those he has done psychiatric care. He's experienced in critical care. He's experienced in psychiatric emergencies, and he has served for 10 years. Really? In the Army. So we have to say thank you for your service. That's right, we didn't even know that. He's currently serving as an advanced nurse practitioner in a community psychiatric clinic, a nonprofit clinic which was opened last month, right? Was it last month? Yes, in January. He sees patients of all ages. So if you know anyone who needs psychiatric care, then you can speak with Anthony. This evening, Anthony is going to be presenting acute stress. After he speaks, then we'll have about 10 to 15 minutes to ask questions about the topic. Anthony, we welcome you. The time is yours.
Thank you, everybody, for coming today to support the program. Thank you, Dr. Cooper, for putting the program together. As we know, and as we heard today, and as Pastor Brown was preaching today, mental health is so important, even more today than ever before. And so I'm very thankful that we're putting greater emphasis on mental health, because we know that the numbers have increased, and unfortunately there's a lot of people who are suffering a variety of different mental health illnesses. I am going to be speaking on acute stress disorder that comes together also with with PTSD. The only difference is the acute stress disorder has to happen at least 3 days, but it's less than a month. Once it's over a month, now we're talking about PTSD. But when we hear PTSD, what's the first thing that a lot of times comes into our minds? The only ones that suffer from PTSD are what? Soldiers, right? That's the first thing that comes to our mind. Veterans, soldiers, oh, you're a veteran, you must have PTSD. You've been to war, you must have PTSD. I will tell you that at least almost 8-10% of the population, the general population, suffers. I would say even more than that, suffers from acute stress or some form of PTSD as well. A lot of it is reported, a lot of it is unreported, and so the numbers are kind of skewed a bit, but I'm especially after COVID and after all the things that we went through with COVID, post-COVID, I'm sure the numbers are quite high. Let's see this. Okay, so the first thing we'll kind of go over are what's that diagnosis? How do you diagnose somebody with acute stress disorders? What exactly are we looking for? One of the things with the acute stress disorder, and I'm going to go by the DSM-5, which is the manual that we utilize in psychiatry to diagnose individuals with different kinds of conditions or ailments. So the first thing is that the exposure must be to the actual or threatened death, serious injury, or sexual violation in one of the following ways. It can happen directly, experiencing the traumatic event. It can be just witnessing a person in an event as it occurs to others. You can be walking around, you see a traumatic accident can be traumatizing to you. Number 3, learning to the event that occurred to a close family member or close friend. Number 4, experiencing the repeated or extreme exposure to adversible details of the traumatic events, such as first responders, EMS. We know that, I will tell you, when I worked in the emergency department, I came from a floor where I was doing medicine, and I went to the emergency department. I was working in a level 1 trauma department there at University Hospital, for those who know it, well, I'm sure we all do. It was fast, and we were seeing all kinds of cases. I mean, you're seeing all kinds of trauma coming through there. I will tell you, and my wife will tell you, the first few weeks, I would have nightmares never experienced nightmares like this before, but I would have some terrible nightmares, and that was all from being exposed to all the things that we were having to deal with at that point, in that kind of setting. The other thing we also have to know is that this does not apply to exposure through electronic media, television, movies. So you can't just watch a movie and say, well, it was a scary movie, it's a traumatizing movie, and all of a sudden now I got PTSD or I got acute stress disorder. It doesn't work that way. However, if it is related to your job, right? If it is, let's say you're a trooper and you see explosions and you see the great damage or whatnot, then yeah, it could very well cause you to have PTSD. I can speak on that from experience. There was one young man who actually had just gone into the military. He didn't even make it out of basic training. He went to his job training. He was a combat engineer, just looking at the explosives and looking at video footage of the explosives and the damage it caused. Like I said, he didn't even make it out of his job training. He ended up having to be hospitalized for PTSD. So he ended up coming down here. He was actually treated at DHR for PTSD, and he was there being treated for that. A lot of us who've served in the service might say, how is that? Like, we can't, like, that's not possible. Even me myself, I say, well, if you've been in the service, you know what you're getting into, and you know what you're going to be exposing yourself, what you're going to see. But everybody's mind is different, and so we have to understand that some individuals have different thresholds as to what they can handle, what they cannot handle. We're going to see in a bit what are some of the things that can actually affect that threshold, or what are some of the risk factors. So some of the traumatic stressors include community violence, war, terrorist attacks. I will tell you, I worked with somebody who worked as an EMS during the times with the Unabomber. Then in Oklahoma, he was there. He was an EMS. He had to report when all the explosions went off. We all know the story, most of us, I'm sure. And up to this day now, he's dealing with PTSD from that. He's now serving as at that time he was serving as an EMS responder. Now he's serving as a psychiatric nurse practitioner, but he still lives with that memory. Also being a hostage, fire accidents, grossly injury to self or others. I spoke about accidents, childhood sex abuse. I will tell you, we see those who work in the area, and you don't even have to work in psychiatry, you can work in any medical area. We run into a lot of children, a lot of even adults who've gone through sexual abuse as a child, and now, unfortunately, they're suffering the traumatic experience, or they're suffering with PTSD, and it's caused an impairment in their lives, in their jobs, in their family, and so forth. Rape, sudden personal losses. So as far as the reaction to trauma factors or whatnot, what influences the way we react, or one of them could be individuals' pre-existing characteristics or conditions, previous exposure to trauma, right? The meaning of the event to that individual, personal and social resources. The more resources you have, right, the more community resources you have, the more resilient you can be, right? The more you can overcome. But the less support, well, it becomes a bit harder. As far as the risk factors, pre-existing psychiatric disorders. So if you already suffer from anxiety, some form of anxiety, whether it be generalized anxiety, social anxiety, some form of anxiety or depression, you're already predisposed, including personality disorders, history of previous traumas leading to increased risk. I just spoke about that. Events in later life might trigger previously unrecognized PTSD. So there are individuals who may not have suffered, and I've seen it in my own work life where where an individual didn't suffer with anything, and all of a sudden, I had one woman who watched a movie, and all of a sudden, from that point, after she watched that movie, from that point on, she started having now nightmares and started having the symptoms of PTSD, and we're gonna of a PTSD, and we're gonna go through those symptoms here in a little bit. But she started now having all these symptoms, and now you have to start treating her now like if you was treating her as if when she just had the trauma when it happened so many years ago. But now to her, it's so real. Some difficulties, of course, if you had arrest, unemployment, homelessness, divorce, all these things. Any of these situations, obviously, makes it harder. Now, B, according to the DSM, Part B says that the presence of 9 or more of the following symptoms from any of the 5 categories. So the 5 categories are intrusion, negative mood, dissociation, avoidance, arousal. And I'm going to break it down for you so you understand exactly what fits into each and every one of these categories listed below. Now, as far as intrusive symptoms, so intrusive symptoms can be involuntary and intrusive, distressing memories. They can be distressing dreams. As I said, I had nightmares. I suffered through acute stress disorder working in the emergency department. There are individuals who suffer from traumatic accidents. Yes, there are soldiers who've gone to war, and unfortunately, those memories come back, right? It doesn't have to be just nightmares. It can be part 3, as it says, it can be flashbacks. You can be walking through the day, and here, now you're having flashbacks up to those memories. You can go to a certain place, and just by being in that certain place, it will bring back memories. It will bring back images of those things. Number 4, intense or prolonged psychological distress or marked physiological reactions in response to internal or external cues. And I just, he just went over that. Negative moods, persistent inability to experience positive emotions. So these are individuals where you see them every day, they have this look like, man, it's like there's no sense of happiness, there's no sense of joy. There's this heaviness. You can feel it. You can feel it. If you work with these individuals, you come to a point where you actually start, you feel the heaviness. Dissociative symptoms, an altered sense of reality of one's surroundings or oneself. So you basically, you're seeing yourself from another's perspective. It's kind of like you're in a daze, your time, everything just shuts down. It's like things just frozen. Inability to remember an important aspect of the traumatic event. So the body, a lot of times the mind sometimes compensates or tries to use it as a coping mechanism. So shut that part. And you'll have individuals that'll say, well, man, I don't remember the I don't know. Sorry. So you have individuals who say, you know what, I'm suffering. I don't remember that part. I know it happened, but I don't remember. Why? Because the brain is trying to cope, right? Doesn't want to remember. So I have individuals who've been raped or who've gone through child sexual abuse, and they don't remember. They shut down. I have individuals who even say, well, you know what? It was my altered personality. And all of a sudden now they have different personalities. And you ask them, well, what happened to you when you was a child? Because, well, I was raped, and I think it's just my altered personality, but my actual personality doesn't remember. And so you would hear that a lot. Okay. As far as avoidance symptoms, I spoke on that. You go to certain places, and it reminds you of things. So you avoid those places. So you might remember an accident that happened, I don't know, on 281. Well, now you're not going to take 281 anymore. You'd rather take the longest way because you don't. Every time you go through there, you remember what happened to you, right? You might avoid certain people because by seeing this certain people, it brings back memories as well. So you remember people's, places, conversations. You start avoiding these things, right? And the problem with that is that then it becomes an impairment in your social life because it becomes an impairment in your job, right? There's certain jobs that you might avoid, you might not want to do. As far as arousal symptoms, sleep disturbances, you'll see, man, I can't sleep. Well, first of all, if you're having nightmares, you don't want to go to sleep. You see a lot of individuals say, I can't sleep because I'm going to have nightmares. That's number one. Becomes irritable behavior. They have angry outbursts. You see them with anger. I had somebody that just came in this week actually and said, you know what? Unless I'm on medications, he said, unless I'm on medications and it's the medications that I know work for me, I'm going to go off. And he has gone off before. He has been had to be admitted to the hospital due to his behaviors. They become angry. all of a sudden it's poor self-control a lot of times. Hypervigilance, right? You're always watching, okay, you know what, now you're not at ease. You're always watching that something's going to happen. I remember getting into an accident one time. It was a rollover accident. And I said every time I went to that same street or every time I had to make the same curve, I did it slowly because I was scared that the same rollover accident is going to happen again. It's that same kind of fear, like you avoid, so you're always kind of careful, but you're always watchful. As far as you're always watching your surroundings, you're always, always in a watchful sense. Problems with concentration, obviously, who can concentrate with all these things happening? It's very hard to concentrate. So problems, it seems like you start having memory problems now. Exaggerated startle response, so any sounds that you hear, you get startled, right? Persistent, then you have negative results to all this. You can have persistent attempt to avoid situations. We spoke about that. Your interest, things that you used to be interested in before, now all of a sudden, you can't even enjoy them anymore. You have no interest. Now, your inability to trust might just lead to you withdrawing from others. You become more isolated. You see a lot of these individuals, they stay in their homes. They don't really go out. They don't really have much friends. They become detached or estranged from family, from friends, from others. There's mistrust, there's isolation, I spoke on. A lot of times there's anger towards God. You say, you know what? We can be angry with God because, my child died. Now I'm angry. Why didn't you do something, God? I got into this big accident. I lost why didn't you do something for me, God, right? I was a soldier and I was serving my country along with my brother, and here my brother died. He got shot. And now why didn't God do something about it? So you get angry. You get angry with God. You have this unresolved grief, fear of losing control of emotions. It just, like I said, it just disrupts your life in such a huge way. Now let's talk about some of the interventions. There's so many different things that can be done to help individuals who are suffering with PTSD or acute stress disorder. Some of these interventions are empathy and reassurance that they will be safe and need to be taught relaxation techniques. Take time to focus on emergent problems and potential solutions. Encourage adaptive coping skills, right? You got to teach good coping skills. There's maladaptive coping skills, and there's a good, positive, good coping skills. And discourage dysfunctional activities. A lot of times they get engaged into, they start using drugs to make up, right? So they start getting into drugs, they start getting into drinking, they start using maladaptive or bad coping mechanisms to try to make up, right, for everything that they're going through. And so they need a lot of encouragement, a lot of support so they can get through that. Develop interpersonal skills and reestablish the relationships as well. Very important. Social activities. Social activities can rebuild social skills. Recreation and exercise programs, of course, that can certainly help. I will tell you that for troops in San Antonio, there's actually a place where they go and they have horseback riding. They even give them a dog, a personal dog. All those different things to help them to overcome so that way they're not using drinking, right? Or they're not using drugs as a coping mechanisms. Instead, they're building hobbies and they're building social connections to help them to overcome all these things. As far as groups help to build that self-esteem. It helps with decision-making, being assertive, anger management, right? Because now you're learning to deal and relate to others. You're learning relaxation techniques. So it's very important, of course, to utilize all these things. Be non-judgmental and be honest. Offer empathy and support. Assure that the feelings and behaviors are typical reactions. It's okay to say, yes, I understand what you're feeling. I know you may not have gone through it, but you can either empathize or sympathize, but you can certainly say, you know what, I'm listening to you. Even if you're just a listening ear, that's all they want. Just a listening ear, somebody who's going through this. Help patients to recognize the connection between the trauma experience and their current feelings, their behaviors, and their problems or whatnot. Yes, we do utilize a number of medications, especially if you're working more on the psychiatric side of things. We tend to use more of the medications, and then we typically leave the counseling and the therapy and all that to more LPCs and LMSWs and so forth to actually do the talk therapy and whatnot. In psychiatry, but again, it depends on how you practice, because there are times, and I will tell you that I myself practice in this way, where you do a combination of both medications, yes, but also some talk therapy or whatnot. So it really depends. Anyhow, as far as medications, one of the medications that we do use are SSRIs. What are the SSRIs, as you see listed there? The paroxetine, things like Lexapro, things like Zoloft that many of us have heard of before. Those will help. Those will help to alleviate at least the symptoms that they're experiencing, because you cannot expect somebody to really get the fullness, right, out of a therapeutic, right, a therapy, right, session when they're going through all these symptoms that I just spoke about. It's very hard. If you're going through a lot of anxiety, you have a lot of depression, you have all these symptoms that are just pressing on you, how can you sit down and talk to somebody for an hour at ease so you can learn the coping strategies and the mechanisms and whatnot? So it's a combination a lot of times of both. Yes, there are times when just strictly therapy will do. We got to sit down and figure that out. Okay, can you do without medications? Can you do with just the therapy and do without the medications at this point? Or is it hard to do that? And really, we need to do something about those symptoms. I always tell patients, I say, you know what, medications is just a Band-Aid. It's a Band-Aid that's going to get you through, so you can now get that therapy that's going to help you in the long run. A Band-Aid, if you have a bleed, you put a Band-Aid on that bleed so you can stop the bleeding. Now the healing process can begin, and eventually that Band-Aid may come off or whatnot. A lot of times we use antipsychotics, right? There are some patients who are going, like I said, who have hallucinations even. There are patients who have all kinds of, they're, as it says there, hyperarousal and sleep disturbances. So a lot of times we use medications like Seroquel to help sleep, or Seroquel to even help with the irritability. And so there's a lot of medications that we can utilize to help the patients overcome the symptoms that they're having. A lot of times they don't want to hear therapy until you do something about the symptoms that they are having. So very important to remember that. Now let's talk about biblical perspective. I'm so happy that Dr. Cooper put in this the program today. I mean, mental health. I love mental health. Yes, I worked in different areas of in the medical field or whatnot, but it doesn't even matter which area I worked in, whether it be medicine, critical care, whatever it may be. Mental health was always there. Mental health was always there. It was always there because always that patient where in that bed needed somebody to sit down and to communicate and to talk with them. That's all they wanted. Somebody to spend time and to speak with them and that actually helped motivate to get them up and going. And you don't have to be a medical worker or something. You don't have to be a doctor. You don't have to be a nurse. You don't have to be a PA. Whatever it may be, you don't have to be any of that. A lot of us, we know individuals who are going through mental health conditions. And Ellen G. White, as it says in Volume 1, Chapter 1, it says that dealing with the mind, understanding the mind, and I'm not going to read through the whole thing, but you can look at Volume 1, Chapter 1. It just goes over the importance of understanding how the mind works. Right, and she wrote chapters, books. I mean, Mind, Character, and Personality, multiple volumes on mind, character, and personality. And understanding how the mind works is so critical. And if we understand it, again, we don't have to be a medical worker. You can help your neighbor. You can help your friend. You can help a family member. And I see individuals every day. And I say, wow, if somebody had spent just 5 minutes speaking with this person, if somebody had spent 5 minutes embracing this person and giving just a listening ear, things may just have been different than it is today with them. Now, in 2 Corinthians chapter 12, verses 7 through 10, and Pastor Brown hit on this today. He spoke about that today. The thorn right, that Paul had on his flesh. A lot of these individuals who are going through this acute stress disorder or PTSD, man, we just went over the symptoms. They feel this thorn and they can't get rid, and it's just so troubling or whatnot. Some other verses, it says in verses 8 through 9, it says, 3 times I pleaded with the Lord about this, they should leave me, but he said to me, my grace is sufficient for you, for my power is made perfect in weakness. Therefore I will boast all the more gladly of my weaknesses, so that the power of Christ may rest upon me. So we gotta take them back to the cross. We gotta take them back to Christ, where God's power can now work through their lives. In Romans chapter 12, verse 2, it says, do not conform to the pattern of this world, but be transformed by the renewing of the mind. So God's word has power to renew the mind and change the mind of a lot of these individuals and help them get through what they're going through. But I will tell you that community support is so vital, that church support. This is a community, this is a family. That church support is so vital. In 1 Thessalonians chapter 5, verse 14, it says, believers are called to encourage the disheartened, to help the weak, to be patient with everyone. In Galatians chapter 6, verse 2, it says, we're exhorted to carry each other's burdens. In this way, you will fulfill the law of Christ. And finally, I want us all, if you all can join me, we'll read Psalms chapter 91. And it says, whoever dwells in the shelter of the Most High will rest in the shadow of the Almighty. I will say of the Lord, he is my refuge, my fortress, my God, in whom I trust. Surely he will save you from the fowler's snare and from the deadly pestilence. He will cover you with his feathers, and under his wings you will find refuge. His faithfulness will be your shield and rampart. You will not fear the terror of night, nor the arrow that flies by day, nor the pestilence that stalks in darkness, nor the plague that destroys at midday. 1,000 may fall at your side, 10,000 at your right hand, but it will not come near you. You will only observe with your eyes and see the punishment of the wicked. If you say, the Lord is my refuge, and you make the Most High your dwelling, no harm will overtake you, no disaster will come near your tent, for he will command his angels concerning you to guard you in all your ways. They will lift you up in their hands so that you will not strike your foot against a stone. You will tread on the lion and cobra. You will trample the great lion and the serpent. And finally, because he loves me, says the Lord, I will rescue him. I will protect him, for he acknowledges my name. He will call on me, and I will answer him. I will be with him in trouble. I will deliver him and honor him. With long life will I satisfy him and show him my salvation. Thank you very much. Psalms 91. So powerful. Share that with somebody who may feel like they're alone, that they're going through something. Share that with somebody so that they know, you know what? God is with them, that God does protect, and that God does offer that salvation that so many are looking for.
Thank you so much, Anthony. I know we all have experienced acute stress. Now, what I'm going to do, I'm going to change the program somewhat so that all the presenters will present. Then, at the last 1 hour, we'll have all the questions, because I know we're going to have overlapping of questions. We don't want to run out of time. So, at this time, we have, as I mentioned earlier on, Dr. Dorcas. I will not attempt to say her last name. I'll have her tell us her name later on. She drove all the way from San Antonio. She's a Seventh-day Adventist doctor, the 5th child for her immigrant parents from Nigeria. She was born here in Washington, D.C. She did her undergraduate studies at our university, Columbia Union College. Then she moved on and did her medical school at Loma Linda University after receiving a scholarship from Health Service Corp scholarship. She has worked for 10 years in community mental health centers in Arkansas and in Texas. She's currently working in San Antonio, and I'm going to let her, I have a whole long bio here. I'm trying to pick out points, but she will tell us a little bit more about herself. And at this time, we're going to give the time to Dr. Dorcas as she will discuss coping with anxiety. You know, initially I had put, what did I put there? Overcoming anxiety, and she wrote back, you don't overcome anxiety, you need to manage and treat it. So I just gently changed the topic to coping with anxiety. She's a psychiatrist. I have to listen to her. Dr. Dorcas, the time is yours. Welcome to Mission Hope.
Thank you, Dr. Cooper, and thank you, Anthony, also for considering me to come here today. So greetings from San Antonio. I started driving this morning, but I made it, praise God. I'm here because I really, as Anthony was saying, I love mental health. It is important to do a job that you love, and this excites me. It made me drive from San Antonio all the way here by myself, you know, so I didn't care. I'm like, I got to tell the people about mental health because it's not talked about enough. So again, my name is Dr. Dorcas Adepoju. My parents are Nigerian immigrants, so I was born and raised here, so you may not hear an accent, or you might hear a mix of stuff because I have friends from all over. So let's get started. Let's see. I don't know where I'm supposed to point it though. Do I point it this way? Like, and towards where? Thank you. Okay, great. Okay, so anxiety, it's interesting. I don't actually like public speaking, so when you asked me to come and speak, I did have anxiety about it. But one thing I've learned, even before I became a psychiatrist, is if you have anxiety about something, you just got to do it a little more, especially something, you know, it's good for you, right, to talk to people and present what you know. So the more and more I get up in front of people, the less anxious I become. Anxiety is very common. We all experience it. That's why I put up there the 12-month prevalence. And this is in adults because I mostly treat adults. I don't, you know, it's been years since I treated children. So you're going to get a lot of the statistics for adults. And as you see the statistics up there, I'm going to be talking about all of those. That's a lot because you saw how long Anthony took just for one. So I'm going to try to get through these. But you see the percentages. In 12 months, these are the percentages of adults that will experience these type of anxiety disorders. That's why I don't define anxiety itself, because there's multiple ways of experiencing anxiety. So we're going to start with panic attacks, the most common anxiety. I think at some point in your life, you may have experienced it. Maybe you're about to have you're about to have like a car accident or just something unexpected happen, and for some reason in that instance you didn't cope well and you couldn't breathe and you felt out of control. But these are the symptoms. As you see, your heart rate increases, you're sweating, you're trembling, you know, can't like I said, can't breathe, or you feel like you're choking. Your digestive system cannot work properly when you're panicking, right? Because it's a fight or flight thing. So your blood is rushing away from the stomach and into your muscles because you're about to do something. You're either going to freeze or you're going to run or something. So you can't digest well. Chest discomfort, dizziness, lightheadedness. All of these may sound familiar because we've all experienced it. And sometimes some medical issues will give you the same symptoms, and I will go into that briefly. You know, feeling numbness, tingling, feeling detached. Anthony had talked about that detachment from the world, like you're outside of your own body and this world isn't real. You get that feeling of loss of control or fear of dying. This can all happen suddenly. So those are panic attacks. The reason I wanted to separate panic attacks from panic disorder is we all have panic attacks. Don't feel that something is wrong because you had a panic attack. You know, anybody can have it. You don't necessarily have to go to the doctor because you experience all those things I told you. You know, your body will get back to baseline. But then there's something called panic disorder, and as you see, the percentage of panic disorder is less than the percentage of panic attacks, because panic attacks are very common. But to have a disorder, once again, you'll have these symptoms, and I won't go through them again because you saw them, but these things come on suddenly, and they peak within minutes, maybe about 10 minutes. I mean, and it feels very, bad. And this, once again, as Anthony has said, comes out of the DSM-5, the Diagnostic and Statistical Manual, where they it's based on statistics mostly in the United States, but these are the symptoms that they say is coming in panic disorder. The attack is followed by a month or more of these symptoms, a persistent concern or worry about additional panic attacks. So now you had a panic attack, and now you live in fear of future panic attacks. And then, or you change your behavior to avoid another panic attack. I actually have a friend who doesn't take the freeway. She had a very bad accident on the freeway, so she just drives on access roads and takes forever to get to places. That's how she copes. I mean, I gotta live with it because she's always late, but it's what it is, These symptoms are not due to the physical effects of alcohol or illicit drugs or medications, because once again, I said we've all felt that list of symptoms that I told you about. So, because alcohol, when you're withdrawing from it, can cause those symptoms. Certain medications can cause those symptoms. So, just be aware. That's what a doctor or medical professional has to focus on. That, is this a psychiatric thing, or is this a mental health thing? You can have both, but the doctor has to try to figure it out so we're not treating the wrong thing. And then, once again, you want to make sure it's not due to another mental illness. Anthony talked about acute stress disorder. There's other anxiety disorders that I'll be talking about. Though, a psychiatrist has to differentiate what is the issue. Because when you diagnose correctly, you can treat correctly, you can explain it to the patient, and when the patient knows what's going on, it actually lowers their anxiety. So hyperthyroidism. Some people have thyroid problems here. Some people have low thyroid, and then they get the medication to correct it, but then it overcorrects, and then they get those symptoms that you saw listed. So it's interesting. So this is just giving you examples of the things that we just talked about. When someone's having a heart attack, they can have the same symptoms. So a lot of people go into the emergency room in a panic attack, not knowing it's a panic attack, thinking it's a heart attack, but then once again, the emergency room, medical providers have to figure out what is this. But they're going to first treat it like a heart attack because you can die from a heart attack. And when they rule it out, they'll tell the patient it was a panic attack. So just be aware of that. Specific phobia. Everybody, I think, knows about specific phobia. I think I may have, okay. Some people, everybody has well, I shouldn't say everybody. Some people have that special thing, because you see 8 to 12% of the population, adult population in a year will experience a specific phobia. Spiders, the dark, so forth. We'll talk about it. Let's see. I don't know if I can turn it. Yeah? Okay. Yeah? Okay, thank you. All right. So the symptoms, significant fear or anxiety about a specific object or situation. This object or situation almost always causes immediate fear or anxiety. This object or situation is actively avoided or endured with intense fear. So it's either you avoid it completely, or if you're around it, you're just like, in your frozen state or whatever. The fear or anxiety, it far outweighs the threat. The spider is this small, it's all the way over there, but I'm here and I'm freaking out. It can't run to me, I can always run that way, but yet I'm frozen in fear. It can happen. Some people, even just a picture of that thing, like if it was a spider, would really mess with them. So fear, anxiety, or avoidance of all these, of the thing that you're afraid of, lasts for 6 months or more. This is all just diagnostic criteria. The fear, anxiety, or avoidance causes significant distress. So if it's like, that spider is over there, and therefore I cannot stand here and give this talk, that's a problem, right? It's extreme. So these symptoms are not better explained by other mental illnesses. So I brought up the spider because I guess my daughter's afraid of spiders, but so everybody has their thing. Some people have a fear of dogs. We'll kind of, they may have had a bad experience with a dog in the past, and then, of course, I panic, anytime that happens. Some people don't like their blood getting drawn and things. They'll pass out if they see blood. So these are examples. So I wanted you guys to see the professional terms, and I was looking up the prefixes. They're from Greek, mostly. So you see the different kinds of phobias. And, I just thought it was just something interesting. My daughter likes, she's 12 years old, she likes these big terms, so she likes to say them and throw them around. So anyway, so social phobia. This one is fun. So I appreciated, Anthony, that you talked about yourself, because I'm about to talk about myself. And once again, I don't like speaking in front of people, but you see me here today, right? So, I have to acknowledge I have social phobia, but, one of the treatments of social phobia is to do that thing that you're afraid of. So guess what? I'm here. So it's an intense fear or anxiety in one or more social situations. Having a conversation, meeting new people, being observed when eating. Some people can't eat in front of people. I know people that go to another room. They can't do it. Performing in front of others or giving a speech, see, like I'm doing. So, so the person is afraid of embarrassing or humiliating themselves. So they got these thoughts going through their mind, what if I do this? What if I, mess up? What if I say something wrong and then the whole world, everything is over, right? So social situations, they almost always cause this individual to experience fear or anxiety. And then the social situation is avoided or endured with intense fear. I'm actually pretty good because, like I said, I learned that the way to combat social phobia or any type of anxiety is to face it. So I've been putting myself out there a lot. Some of my New Year resolutions from years ago is like, once a year I'm going to actually talk about, to somebody about psych, maybe in front of people. I've done it over a conference line, but, just because I can easily, be relaxed and stay home and just do nothing. It's so easy for me to do that. So important points, once again, from our diagnostic and statistical manual. This fear is out of proportion to the actual threat. Yeah, let's say I mess up, then, what's going to happen? I'll still live. Tomorrow will come. I'll survive. The fear, anxiety, or avoidance of the social situation lasts for more than 6 months. This is not just a temporary thing. This is the condition. And I've been experiencing it for years. I've been combating it for years, or managing it, Dr. Cooper, for years. So by forcing myself to actually give presentations, because, that's just the way to do it. So this fear or social situation causes significant distress. Yeah, some people, they will switch jobs rather than give a presentation in front of their coworkers. Or I know some people, they'll just take the failing grade. They told me that. They won't give that presentation in front of their classroom. They'll just take the failing grade. That's how bad it is, So these symptoms are not due to an illicit drug. This is just disclaimers, just to say this is why it's the social phobia. It's not because of drugs. It's not because of another mental disorder. It's not because of a medical condition. This is important. That last one, this was in our diagnostic and statistical manual. Some people have medical problems that they're embarrassed about. They start shaking or whatever, and they don't, that can make them have fear of being around people. So, Parkinson's disease, obesity, they have some type of disfigurement, they just say we should distinguish what is really going on. And if it's a real thing, that's something that's actually happening, that this anxiety, this social anxiety far exceeds, the condition that they're afraid to present. Now, the last thing, these are not all the anxiety disorders, by the way. These are just the most common. And I wanted to, once again, focus on the most common because I just want you to know other people are experiencing it. In a 12-month period, 2.9% of adults are experiencing this. But in a lifetime, it's even longer. It's like, I mean, it's even more. It's like 29% of us, I mean, a third of the people in this room are going to experience this. So the symptoms: excessive worry. I messed that up. So anxiety, I meant to say, and worry for more days than not about various events or activities for 6 months or more. And the person finds it difficult to control their worry. We all worry, right? But at some point, you know, some of us will resolve that worry, but others, it just keeps going. So the anxiety or worry is accompanied by 3 or more of the following symptoms for at least, and one of them has to be for at least 6 months: restlessness, feeling on edge, feeling fatigued, because anxiety it just saps your energy. You can't be anxious and relaxed at the same time. It just drags the energy out of you. Problems concentrating, your mind goes blank. So if I'm up here, thank goodness for the PowerPoint, right? My mind could have gone blank and I stopped talking. I don't know. Irritability, muscle tension, problem sleeping. You can't relax to sleep when you're anxious. So these symptoms cause problems at home, work, or other important areas of functioning. And once again, I say we all experience anxiety, but when it becomes a problem, it is a problem. So that's the difference. That, you know, anxiety versus an anxiety disorder, right? So just keep that in mind. Again, same things that are in our diagnostic and statistical manual. A good psychiatrist and a medical provider has to distinguish between, is this due to drugs? Is this due to another medical condition? You know, we want to treat the right thing. So we're going to have to try to rule out the physical things before we can say, okay, this is probably just anxiety. You know? So how do we combat anxiety? You do have some control. So let's see. All right. So you address the anxiety-provoking issue. Sometimes you have a conflict with somebody, and it's like it's hard to be comfortable, let's say in church, when you know you have a fight with someone else in church, and then it's like, okay, I got this anxiety, and you guys never got together and talked about it. If you talked about it, maybe it would help a little bit, and you have less anxiety. This presentation, I always have anxiety about performing because, you know, you have to do some work, right? And so the way to combat that anxiety is to actually work on the presentation, research. The more prepared you are, the less anxiety you have. Distraction. What I've noticed in patients, and I pointed out to them, did you notice that you were so busy with this that you forgot that you were anxious? You know, when you're distracted by exercise, TV, talking to a person, whatever, they're not anxious, you know. I had to remind them that they had a problem. Which is funny. So that's why I told them, like, especially the patients that always want their meds bought up. I'm like, you know, this is what you could do, and it's doable, and see how you got distracted by doing something productive. Yeah, I don't think I need to change your medicine. Just work on this, you know, and they agree. Exercise. It's hard to be anxious and exercise because exercise alleviates anxiety. It releases endorphins, you know, makes you feel good. It's hard, you know, but I'm not saying there's some, you know, despite what I'm saying here, there's some people that have anxiety that's worse, that these things aren't going to help. I'm just going to let you know. So I don't want anybody to think that these are the only solutions. Things that you can do. You can decrease the stress in your life. I'm going to tell you that I decreased the stress in my life. COVID, I think, made a lot of us think about how our lives were going. And I was like, I don't want to work like this. I don't need all this money, because you couldn't go anywhere, so like, why do I need this money? So I actually left a full-time job, and I'm doing contract work now. So I work when I want to. I have time for my daughter. I support her. She does gymnastics, you know. So I was like, this is more important to me. I don't need all this money and 40 hours and all this stress, and I'm doing notes at night. I'm like, no. So I just decreased the stress in my life. Eliminate stimulants. Some people are telling me they got anxiety, because I work in a drug rehab, actually, and they tell me they have anxiety, but they're drinking all this coffee, and I'm like, okay, you need to cut down this coffee, because coffee and, you know, tea, you know, have caffeine, and it increases your heart rate, and it just gives you the physical symptoms of anxiety. So you're telling me you have anxiety, you want me to give you medication, but all you got to do is cut down your coffee intake. So I tell them this all the time. Let go of perfectionism. This is my problem. I do have a problem, like, it's just what it is. But once again, over time, I've just learned to let things go because I can't do everything. Acceptance, accept my flaws, accept that I'm a human being, accept that I'm going to mess up, and just be okay with it, you know? So let go of the need to control everything and everybody, because you really don't have control over everything and everybody. So just actually face that fact, and then stop living your life to please others. You know, you're never going to please anybody either, because, you know, you can only control yourself. So treatments, I'm not going to go too much into it because I'm sure this doctor here, and I'm sorry I don't know your name, but yes, that he'll talk about that. But mindfulness practice, mindfulness, being in the moment, experiencing life, just reflecting but not judging, because anxiety comes from when you judge a situation. I tell my clients all the time, because I used to live in California, and there's all these fires that happen spontaneously, right? And so I say 2 people can have their house burned down. One of them says, I am destroyed, my life is over. And the other person says, you know, I get to rebuild and make something new. But the same thing happened to both people, right? So what you perceive is what your reality is. Relaxation techniques, I'm sure the doctor here will tell you more about that. Psychotherapy, cognitive behavioral therapy, I love it. I love it for anxiety. And then exposure response prevention. So once again, I really don't like talking in front of people. I don't even know why I do it, right? But once again, I know that it's the cure to my social anxiety, and specifically the performance anxiety is part of the social anxiety. So by me doing this, I'm exposing myself to the thing that I fear, and it doesn't affect me as much. See, so you get to see it in reality right here. Medications, as Anthony had gone through, and I didn't want to bore you with medications and all kinds of things, but it's interesting, for a lot of the anxiety disorders, psychotherapy can help, medication can help, and in some cases, psychotherapy helps more than the medication, and then there's some research that says both together are best. It just depends on which one, right? So what does the Bible say about anxiety? I'm glad we all, you know, we're here, we're Christian. Some people, I think, believe that you can't be Christian and a psychiatrist. I mean, I've heard that before, but whatever. So anxiety in the heart of a man causes depression, but a good word makes it glad. I like this text because it's true. When someone is run down by anxiety, they will become depressed. So this is something to just think about. And I love this one too. For God has not given us a spirit of fear, but of power and of love and of a sound mind. That's 2 Timothy 1, verse 7. And I don't put this here to blame anybody for being anxious. We are human beings. We live in a fallen world. Our bodies and our minds are not perfect. So we will experience anxiety. So I'm not blaming anyone for being anxious, but I'm letting you know that God does address this in the Bible. He says, cast all your anxiety on him because he cares for you. And some people, they just don't feel cared for. They feel alone in the world. It's just nice to know that the God that spoke the world into existence cares for you. And I love this one because my mom played a song and I could sing it to you, but I'm not. But it's about this text, and that's why I know this text very well. Well, and you guys already probably heard it today several times. Therefore, I say to you, do not worry about your life, what you will eat or what you will drink, nor about your body, what you will put on. Is not life more than food, and the body more than clothing? Look at the birds of the air, for they neither sow nor reap nor gather into barns, yet your heavenly Father feeds them. Are you not of more value than they? Which of you, by worrying, can add a single day to his span of life? So do not worry about tomorrow, for tomorrow will worry about itself. And I do tell my clients, especially the ones who have chemical dependence issues, it's one day at a time. You know, let's just deal with today. And I say, if we got to break it down minute to minute to keep you sober, let's do that. Hour to hour, whatever. But let's just worry about today. Tomorrow can worry about itself. You know, because when they start thinking too far about sobriety, a year from now, 5 years from now, they get all, they just get discouraged and say, I can't do it, and then they want to relapse. So each day has enough trouble of its own. It's funny, this morning when I was watching I don't know, YouTube, these final texts came up. Do not fear, for I am with you. Do not be afraid, for I am your God. God is there. He will be with you in this, if you want to call it, this is a thorn. Anxiety is a thorn in your side. He will be with you to manage this thorn, right? Sometimes he doesn't take it away, and there's a reason for that, because there's growth in it. I will strengthen you. I will also help you. I will also uphold you with my righteous right hand, he says. And then I love this one because this is another thing I saw with people that have separation anxiety, children, even adults. When they have a loved one with them, the anxiety is gone. It says, there is no fear in love, but perfect love drives out all fear. And the perfect love only comes from God, and he is always with us. We need to remember who we serve. God is always with us. He didn't leave us alone. So take-home message, having anxiety is not a sin. I just got to drive that home. It's not a sin. We are living in a fallen world. Our minds and our bodies are not perfect. It's not the way God designed it. So we have to manage what we have to deal with because of the results of sin that happened to this world. So anxiety may be due to underlying medical conditions. I drove that home. And then if anxiety is a problem, then you need to address it. Do not be afraid. Because I feel like maybe in these type of settings, we're like, oh, just pray about it or this and that. But you know something? God raised me from this, little girl, child of an immigrant, right, who had no doctors in her family. Like my grandparents, whatever, nobody was a doctor, and I became a doctor, right? And I learned about mental health, and look, I'm here today teaching people. God did that for a reason, So, so he raises people up to help his people, and we're supposed to bear one another's burdens. We're supposed to take care of each other. That's why we're here. So, and those are my references. So, thank you.
Thank you, Dr. Dorcas. So I think you treated yourself today, right? With that social anxiety. Thank you for accepting our invitation. Now we're going to have you stand up. You've been sitting for a while. Stand up, shake somebody's hand and say, do not worry, God is with you. Let us do that. We'll break the monotony here. Do not worry. That's right, that's right. Yeah, God is with me. We're breaking up the monotony here. Just socialize. Laughter is medicine for anxiety and depression. All right, very good. So our next presenter is very well known. I don't know if he's very well known. Should I say he's very well known? Maybe not. We know him as a great musician, right? Plays very well. He adds such, beauty to our worship. But did you know that he was a Harvard University trained scientist, right? And that he's an expert in positive human development. And that he teaches at, he's a university professor. Did you know that? And that he currently is in charge, he works at the city of McAllen, right? And that in his doctoral thesis, he wrote about resilience. Do you know what the word resilience means? All right, I want somebody to stand up and tell me. I don't want these three in the front to say anything about resilience. What do you think resilience means? Okay, that's a good one. Anything? Tell me, brother. You can stand where? That's right. Yes, you're able to bounce back to a stable state, right? It's like a rubber band. You stretch it and you stretch it and you stretch it. And when you let go, it goes right back. Right? That is resilience. So you've been hearing about anxiety and acute stress and all of that. Now, Dr. Lewis is going to talk about how to overcome some of these things, how to be resilient with all of these anxiety and depression. Robert?
Good evening, everyone. A big thank you to the very dynamic Dr. Cooper for putting this together, Christian-based mental wellness forum. This is great. Thank you to Dr. Dokas and to Anthony for preceding me, and you did a very good job putting together what is it to experience disorder, mental disorder, and you were very precise in the term that you chosen, and you basically prepare the stage for me to do what I'm doing now. So this is a human size, not a human brain, but a human size of a human brain, but it's a plastic one. Even though it looks like a real one, it's a plastic one. So the human brain is only 3 pounds of wet meat. 3 pounds of wet meat. Can you imagine? But it controls every single things we do, or disorders, illnesses, and everything it has something to say in everything that we experience, including mental illness and mental wellness and resilience. This is very important. As we advance in my presentation, I will return on it to explain, to help you understand a few things. So let me sum up what my colleague said before. 1 in 2 people will have been or will be severely traumatized in their lifetime. Violence, they will experience rape, abuse, incest, and not to mention emotional abuse, domestic violence. Now we don't use anymore the term witness of violence for kids, but they are victim of it emotionally. They are directly, they suffer directly from that. 1 in 4 people will suffer at least 2 serious traumas, loss of loved ones, a diagnosis of an incurable disease, etc. As for the others, you and we will not escape the inevitable trials of life. I forgot to mention something at the beginning. I was so anxious about my slides not working, so I brought cards instead to make sure that it will work. But the audiovisual guys, you're doing extremely well. Thank you so much. It was unnecessary fear. So you and I, it's inevitable that we experience trials of life in the form of illness, loss of loved ones, abuse, bullying, job loss, financial instability, going from one job to another, sometimes tragic event in the news, such as terrorist attack, mass shooting, natural disaster, global pandemic like we just experienced with COVID. So what does that say is that we need to be aware of the fact that we cannot stay too long in front of the TV absorbing bad news, right? We cannot do that. We should not do that because what we're doing, we're self-inflicting depression on ourselves. We cannot. It's very damaging eventually on us to just sitting there and absorb news, bad news all the time, especially at night before we go to bed. So avoid that. So let's go to the Bible. Genesis chapter 1, verse 27. Can someone read for me? Thank you. Mm-hmm. Exactly. God created man in his own image. In the image of God, he created him. Male and female, he created them. This verse alone should be our biggest coping strategy. Why? Because it reminds us that every human being has an immense source of potential, strength, and ability. Because we're the Son of God. We were created in His very image. We are the most superior being in the whole ecosystem on planet Earth. Whether we are Asian, African, wherever we're from, we possess immense source of potential, strength, and ability. Even in seemingly hopeless circumstances, we possess the ability to secrete a shell, to build a fragile defense barrier around us. So, a certain number of individuals at risk manage to adapt well and build themselves up despite the adverse circumstances, the distressing event, or the trauma they face. We call that resilience. This is resilience, meaning the ability to face extreme situations, to overcome life crises, to bounce back from adversity, and to get out of it even with new skills. What does that say to us is that to some degree, adversity is kind of good to us because some abilities in us, some strength, some skills, we will only discover them when we're in the face of adversity. We come out better. I've seen people become mentors, people who suffered from abuse, become mentors in the community, helping others who suffered from abuse and neglect. That doesn't mean we're not glorifying abuse or neglect, not at all. But what we're saying is that when it happens, there's hope. And fundamentally, we are beings of connections. And based on Genesis 1, verse 27, maintaining a healthy relationship and staying in touch with others, especially those closest to us, is an important factor of resilience when it comes to managing depressive symptoms and reducing the risks associated with mental illness. It's very important to understand the fact that we are beings of connections. Let me play a few quick videos for you to illustrate that. Play number 1, Brother Asnake. Thank you. So we've conducted some research. We couldn't conduct research like that on humans because no ethics committee would approve them. But this is rats that being cared for by the mother, receiving licking after licking, all kind of attention, and etc. So play number 2 now, please. This is number 2? Brother Asnake, is this number 2? Okay. Number 2 is some rats that we remove from the mother at birth. So they didn't receive care, attention, etc. So pause for a little bit. So this one is the same one that received. Let me see. Okay, play that one, please. Okay, this one is the one that was receiving all the cares from the mother. This one is the one that we remove from the mother, and we simulate danger, and it seems to this rat if completely ignore danger. It couldn't recognize danger to develop coping strategies, which is different from this one. We receive all the cares, etc. Play this one, please. So you will see in that video, oops. Okay. How the rat is able to develop strategies, attention, precautions. No, you're playing the wrong one. Play the other one, the fourth one. Thank you. So you see, this one has a sense of danger and strategy. Okay. It will come again. Okay, here it is. Okay. So you see, it's a different kind of personality, you see? So you can stop, you can. Thank you. So it's a different kind. It's just to illustrate some of the aspect of the importance of receiving care and affection and connection. The importance of social support. What we need to understand when we experience mental illness in order to cope and to become resilient, we need to recognize the power of the environment, the power of the social-affective environment of us, the power of words, for instance. In young people, and this is where I'm going to illustrate that with what happened to the brain. The brain development goes from back to front, And the last part to fully developed is the frontal lobe, the center that regulates emotion and strategy, like we see in the rats. So what happened is when in the environment we use words that diminish people, we slow down the development process, their ability to regulate emotion. And in young people, the full development happened between 25 and 27, somewhere like that. So So here we are, we have a person that is not anymore a baby, completely dependent, but that is not yet an adult, and being able to be independent, and because the full development of the frontal lobe is not, it's not done yet. So what happened at this time, at this period of time in the family, there's a lot of potential for crisis. There's a lot of potential for mental illness, because you have a young person that cannot really regulate a lot of aspects, not because they want, because the brain, they are not adults yet. And sometimes we use the word young adults, we treat young people like adults, but they are not. So let's be aware of that. So one way to instill, to promote resilience is to being supportive, and to use positive words, very uplift them. When you put down, instead of, for instance, to say, you're stubborn, you're very stubborn. When you say that, when you say you're disobedient, or you're like your mom, or you're like your dad, when you say that, when the young person is on the road to school, going on campus, this becomes the inner voice. This is what they hear. This is what they have to hold. This is what you build. This is what you put in the mental toolbox. So we can only use what's in our toolbox, right? So in order to have resilience, try to equip people, lift up people, praise people to a certain level of fairness, and engage them in role, encourage people to try new things, praise their success, and when they make mistake, and put emphasis on opportunity to grow they have presented. And it's crucial that progress take place. So one thing that we can engage them in music. Music is very, very, very powerful to prevent, but to help cope with mental illness. Music has this in particular, that it promotes empathy. What do you do in a choir? What do you do when you pray for praise team, when you sing in praise team? You learn to listen to the other. You building your ability to sometimes stop, because music, sometimes you have to stop, you have to go loud, you have to go, and this is what you're learning to do, to share a space with others, and trust me, people who participate in musical activities, they are more likely to be very, to have a lot of empathy. The level of empathy is likely to be very high. Coping skills and problem-solving skills, keep empowering our family member, keep empowering our sons, our daughters. Try to do your best to try to point to their ability. Even though they make a mistake, they have the right to make mistake. It's a time to make mistake. Allow mistake to take place. Like my daughter Victoria, sometimes I know me and Doris, we don't agree on that, but I tend to let her, break a glass of ice. So she learns, she understands. I tend to let her be a child. So we need to let people be themselves, communicate clearly and effectively, and still try to promote emotional regulation, the capacity to manage potentially overwhelming emotion. Sometimes, to some degree, stress and anxiety, they are good, because if we experience zero level of stress, we become lethargic. This is when we like people, we dead people. So stress to some degree is good, but when we need to understand when toxic stress, toxic anxiety, we need to identify them quickly and either avoid them and make home really sweet home. Home should be that place where whatever happened during the day, whatever the problem we experience, once we open that door, it should only be about receiving love. It should be a certainty that, I'm going home now, and where love is waiting for me. So let's make sure that happen, because when there is turmoil and when there is a lot of argument at night, especially, people's sleep are really disturbed, and they experience later on a lot of personality disorders. Potentially schizophrenia is one major personality disorder. One day I sat down with a young person with schizophrenia, and my pen fell down, and it was a big deal, because he identified himself as with the pen, and he was experiencing the pain of that pen that fell down. So it's really, we are fragile. As far as we are strong, as far as we have capacity to overcome adversity, this organ remains fragile. So let's protect this. Let's preserve it, because it is the source of our well-being as well. So it has something called plasticity. It adapts. We can thank God. We were born in God's image. We can overcome adversity because the brain can adapt. The brain can rebuild itself. This is great. This is a great organ. And like you mentioned, you heard people say that can a psychiatrist be a Christian? I heard that a lot. Can a scientist be a Christian too? So we are Christian. God is the greatest scientist. Thank you very much.
Very good. I want to thank our scientist, Brother Robert. So the first part, the first two speakers that went into anxiety and some mental illnesses. Then, of course, Robert went into the science and the brain and the human development aspect. Now, we're here because we also want to see, are there modifiable factors? What can we do so we will not be having anxiety, depression, acute stress for any prolonged period of time? Is there anything we can do? We want that. I know we have people online that are listening and wanting solutions. I don't want to be diagnosed with such a disease. What do I do so I don't get to the point where I need to be placed on medication or, therapy, right? But what can I do now? So our next speaker, the next two speakers, will be more or less addressing this. Munit, or beautiful Munit here. I just love her. She's so quiet. She's so gentle. She's always smiling. What do you know about her? Munit is an RN, but did you know that she also holds a master's in public health? with emphasis on health promotion and education. Yeah, she does. And she loves being a medical missionary. So today she will be talking about inflammation and mental wellness. What are the things that will cause inflammation in the brain, and how can you stop that and become mentally well? Minute, the time is yours.
Thank you, Sister Donna, and thank you, everyone. It was a very beautiful presentation. I've learned a lot. I think everybody knows me here. Maybe very few of you who don't know me. One thing Sister Donna forgot to mention is that I've started playing the piano. Even though there are some people, some little kids who try to discourage me. See, discouragement comes from everywhere. I met one of my friends in HEB, and then she was with her little boy, and we were talking, so what are you doing new? I'm just excited. So I said, you know what, I've started playing the piano. She was excited, but the little boy, he just couldn't, he couldn't comprehend it. Piano at this age? I'm thinking in his head, that's what he's going, because you can see it on his face. And then he said, now, he said, but you're not a little girl, he said. I said in my head, it's okay, when you reach my age, you'll understand. But thank you, Brother Robert, he's pushing me a lot to play, but one of the reasons, honestly, so we can learn from it, one of the reasons that I started playing the piano is I think I'm young, but I started forgetting some things, very simple things. And I have a small piano at home, so I said, it's time for me, to think about something, because I don't want to be 70, 80, 90, and if I make it there. And then I said, I don't even remember anything, right? But anyway, praise God, I'm here, we all are here. And my topic is very, very simple. Everybody knows about it. Everybody. It's just that we just don't want to follow it. Everybody knows. It's inflammation and mental wellness. And let me tell you, all of the leading causes of death in the U.S., they all have something in common. All of them. See, heart problems, cancer, stroke, diabetes, Alzheimer's, you name them. They have one thing in common. What do you think that is? Inflammation, exactly. They all have inflammation. So I'm going to be addressing what is inflammation. We all know it. I'm going to make it very short. We're just going to throw it together. What causes inflammation? And then when I'm talking about it, think about it with regards to our mental wellness, okay? Types of inflammation. What is the major factor of inflammation in our body? Because there is one major factor in our body. What is the connection between mental health and inflammation? Because Brother Robert, explained it. We have a very strong, well-protected brain. It's very much well-protected. So how is it even possible inflammation will be able to touch our brain, right? And how to fix it? Before I go there, one of the things that I forgot to mention was that when Dr. Dorcas and all of them, Anthony, when they were talking about how passionate they're about mental health, psychiatric, and all, I hated it. When I was in nursing school, there was one of our students, his name was Vladimir. He's very tall, big guy. So every time, and I praise the Lord for him to this day that I was assigned with him, because every time we go to the clinicals, I was in Harlingen State Mental Institution. I was there, always behind him, because I don't want nobody to see me, to come to me, to talk to me. I don't want nothing to do with them. And then, we're told when you go to the hospitals, you're told, what is it that you're told as a student especially? Make sure you have the exit, right? Make sure you're right there by the exit. And you do not give your back to the exit, okay? You have to see it. I'm always looking at the exit signs. Always. If you see me, I'm right there by the exit. To make it worse, on my second day, this gentleman comes. And so you're a student, and we can't go by ourselves. We have to be 2 or 3 together. I'm always with Vladimir. So he comes and said, yes, and he laughs and he looks at me. He knows how I'm very much, afraid. He said, you know what, we know what you guys are told. The minute you come here, he said, you were told to look for the exit. I said, I'm dead. I said, I don't want nothing to do with it. But anyway, praise God, I overpassed that. But let me tell you, now I study about the brain. I love it. And I always praise God. What a wonderful God we are. How wonderfully and fearfully we are made. Right, Brother Robert? Beautifully. So anyway, to go back to my topic, it's going to be interactive because it's very simple and we know it really. So what is inflammation? Just by the word of it, what is it? Inflammation. It's inflame, right? Something is hot, something is burning, something is, it's very uncomfortable, right? Something is on fire. That's by word definition. And then by definition itself, it's the body's natural defense mechanism, right? Well, for example, I fall down, I break something, I break a skin, right? My body mechanism said, oh no, she fell down, she broke something. Something is bleeding, right? So whatever in the body needs to go and fix that, that inflammation will trigger the body to go and fix it. Whatever, it could be infection, it could be injuries, it could be anything. So we have two types of inflammations. Anybody knows? We have acute and chronic inflammations. Acute is very sudden, right? It happens just like that. Just the way I fell down, I broke something, and then, it's fixing it. Acute can be for a week, 2 weeks, or pretty much a couple of months. But it should not last more than that, because it's a quick fix. Now we have the second one, the chronic one, which we all should run away as much as we could. That's the one I'm talking about, okay? It stays forever in the body. I will read you two research that was just amazing, amazing. I have a lot of things. I wish I have 10 hours. We'll be just reading of all the research that they did about inflammation and our mental wellness. But as my husband said, I'm just a hoarder of papers, so I think two will be okay. So these chronic inflammations will just stay. You don't even know that they're there. They will be just lingering, destroying tissues and eating up this and eating up that, bones and things. You just name them. They'll be just destroying. And you know what reminds me of that? Which Bible verse? Anybody? Destroying and killing and stealing. John 10:10, exactly. The thief comes to steal, to destroy, and to kill. Exactly, that's what chronic inflammation is. They come to steal, to destroy, and to kill. They rob us of all our cells and tissues of nutrients. They destroy our neurons, our neurotransmitters, everything that the brain needs for us in order to have a good, to avoid depression and anxieties. When I'm talking about this, there's so many things, as all of them talked about it. There's so many things that causes anxiety, depressions, everything. It's not only inflammation that makes it, but I'm talking about only inflammations. Okay, so please take that into consideration. So where do we get inflammations? We get it. How does it enter our body? It's through the foods and the drinks. It's through our mouth, whatever we ingest. Environmental toxins, the clothes we wear, and the detergents that we use. Our skin is one of the biggest entrance to our systems. The makeups, ladies, the lipsticks, the perfumes, the deodorants, those ones, they're all responsible for our mental wellness, by the way. So the one thing that I really want to talk about right now for our mental health regarding the chronic inflammation is the foods that we eat and drink. Which one? The Western diet. Because you know what, growing up, I grew up in Ethiopia, born and raised there. I came here when I was old enough, When we were growing up, I do not remember I'll take it back. I only remember one girl in the whole school who had anxiety. That's all we remember. We never talked about it. It was not an issue because whenever she had exams, she couldn't take it because anxiety will just take the better of her, so she couldn't. Alzheimer's or old people, they were all there, 98, 95. My granddad, he was 80 something, and he had a full-time job. Imagine, full-time job. But anyway, see, our Western diet is killing us. Who doesn't know that? Who doesn't know that? Everybody knows. The only reason is that we cannot be compliant, right? It's too tasteful, it's too addictive that we can't. All of us are guilty of that. But continuing, okay. So what do you think will be the major factor for chronic inflammation? Anybody can guess, anybody. There's no wrong answers. Our GI, our gut, right? Our not reproductive, our digestive systems, okay? Let me tell you, when a baby is born in the embryo, okay, there is one cell, the brain and the gut. They come up with, they are made up of one exact cell, and it's only the brain and the gut. When the baby starts growing, they separate, right? The two organs start separating. So from the body, those two are who has the same exact cells. So I'll tell you why that makes a huge difference later on. So, by the way, the gut has 70 to 75 of our immunity in our gut. Imagine, so if we destroy our gut, what happens? Our immunity is down the drain, right? Most of our hormones, enzymes, amino acids, and all the good stuffs that the brain needs, food for the brain, they're found in our gut. 90% of the serotonin. We know what is serotonin. We all know it has a good, a happy hormone, right? The GABAs, the dopamines, you just name them. The majority of them, we have them in the gut. There's a lot of collections of genes, has the highest metabolic activities in the gut. And there is one entire collection of nerve systems independently, just by the gut itself, independently controlling the digestive system. That's why when we say, oh, I have butterflies in my stomach, right? Young people, when I fell in love, let me talk about myself. When I fell in love with my husband, before he comes, I'm just sitting there waiting for him, that butterfly in my stomach just going crazy, right? It's not the stomach. Well, it is the stomach, but why? Because they have the same connection with the brain. The same signals going up and down, up and down. And then we also said, my gut feeling is telling me, your stomach can't think for you. There is no way, right? It's the brain. But why? Because when you're sick or when you have anxiety, when they talk about it, what do you feel like? You feel like vomiting, right? You feel like your stomach is just so much hurting, you don't want to eat. You think the stomach is the one that's having anxiety. Everything goes here, but why? As they're all connected with nerve system. So we're going to go with I have just one slide there. Very simple. As I said, we all know it, but I just want to take us into something different, okay? So what happens when somebody eats? Digestion starts where? In the mouth, right? So you need good teeth and good saliva there. You chew the food, goes through the esophagus, but right there on the esophagus, you need good peristalsis, right? You need a good movement so that the foods will be delivered in the expected time to the stomach. When it goes to the stomach, what happens? We have good amount of digestive juice. It's just gonna go ahead and does its job and then just throws it down to where? The small intestine. When it goes to the small intestine, what happens? The liver and the bile and the gallbladders, they all pitch in and they start, breaking down the food, and then all the nutrients that's needed will just go into the system. Those that we do not need, where does it go? Everything goes down to the large intestine. Where do you think the party starts in the gut? The party starts in the large intestine. Because you know why? There's some things waiting for there. There's about 38, let me be clear, about 35 to 38 trillions of things waiting there to start the party. But they can only start the party if they get only one thing that's not being digested anywhere but in the large intestine. What do you think that is? Fiber. Because the only thing that's digested, fiber is the only thing that's digested in the large intestine. And it can only be digested by what we call the microbiomes. If you don't have a good, what microbiomes are like? They're simple. They're bacteria and algae and viruses. Some cases they say parasites, but I don't know about that, but they say it will take it, right? So those ones, imagine, there's 38, 37 trillions living together harmoniously, loving each other as long as they get whatever they needed, okay? These ones, when they eat, now, these ones, I want you to see. You can see that, right? So when they eat the fiber, what happens? They change, they create what we call short chain fatty acid. This is extremely important for the brain and for the gut. You know why? Once they eat that, I'm sorry. So when they eat that, they form that, right? So we have, they have so many functions. These microbiomes have so many functions. Some of them, to mention the least and the very important ones, is they support our immune system. So think about it. When I talk about that, when I say that, they support our immune system, think about it, what if we don't have them, okay? So they support our endocrine system. They maintain our neurochemical pathways. I told you that they have good connections with the brain, right? Reduce the risk of inflammatory diseases. So that, so that we can reduce the leading cause of deaths also, right? And of course, they reduce obesity and more and more. So what happens in an unhealthy gut? Unhealthy gut. What is unhealthy gut? What I'm trying to say is we're eating the Western diet, stripped of fibers and all the nutrients. Pretty much they're either zero or close to zero of any nutrients or fibers, okay? What happens when we take those ones? Same process. Take it out, goes into the stomach, what happens? When you take it to the stomach, most of the time we eat them with drinks, right? The gastric juice is diluted. It's too fatty that we're just straining so much our livers and the biles and the pancreases. There's so much strains. And then what happens when it goes to the large intestine? Those hungry 38 trillion microbiomes are upset, very much upset. You know why? They're not getting what they needed. So what happens? They turn against each other. They turn against us because they need to feed something, right? So all the supports that our body is getting from these short chain fatty acids are diminished, okay? When we say chronic, it's over time, 24, 30 years. It's over time, but it's doing its damage, okay? So one of the things that made it very, very special about our gut and our brain is that there's a thick lining. As like, if you can show the next slide, please. There's a thick lining on the large intestine, okay? We call it epithelial, epithelial barrier, okay? It's a barrier. The same, when you see, don't forget about the leaky gut. The one on the left side on my right, that's the healthy lining of the epithelial lining cells. We know what that does? I call it a door. It separates the outside from the inside. So nothing unwanted will go out. Only the nutrients that you need just go out. Anything that's not from our system doesn't come in because we don't need it. So what happens when our gut is bad? We have constipation, so no toxins are going out, but they're just accumulated in the gut, right? We have all those toxins. Now, these microbiomes, they're turning against us. What happened? They're turning into toxins, okay? Okay, so they're turning into toxins. They're becoming toxins. Now, these toxins are destroying the lining of the cells, right? They're so toxins. And on top of that, they're not producing the short-chain fatty acids, right? The short-chain fatty acids are the only ones that help to protect the lining of the gut. If it's destroyed or it's being eroded, if something is right, they just jump into it. Let's say something, where they talked about trauma and all those things, right? When there's trauma in the brain, obviously the lining will be affected. Somehow, these short chain fatty acids will jump into and do their actions and start fixing it. Because, as I said, the lining of the brain and the lining of the stomach, the large intestine, are the same. The only thing that can fix them when they're not, they're leaking or there's a problem are the short fatty acids, okay? So what happens is that now all the toxins are being released from the gut. Why? Now we have those inflamed. You see the leaky gut, the one that's red? Now our lining is inflamed. It started to break. Slowly, years by years by years. Now it's not anymore what? A gut problem. Now it's not what we call it enteric inflammation. It's systemic inflammation. Why? It's every toxin has leaked to the system, right? So it's all lingering where? In the bloodstream, not in the gut anymore. So that's when the problem starts. Because they started, these toxins, they started changing the neurotransmitters. What are neurotransmitters? They're just simply messengers, okay? They take message from one nerve, which are the neurons, to the next target cell. So, and the target cell can be another nerve cell, or a gland, or it can be a muscle. So let me give you a very good example, okay? So one transmitter is sending to your muscle. It's saying that go to the muscles and activate something, anything, right? But instead of going to the muscles, you know where it goes? It goes to a different direction. Because you know why? That path has already been destroyed. If we have neurotransmitter serotonin, okay? It's a calming, it's a happy, it's a modulating, right? It's a mood modulating. And then we have the dopamine, we have the norepinephrine, the GABA, all these things I told you are in the guts, right? Though we still have them, but over time what happens? It starts diminishing being produced in the gut because they don't have the right nutrient, they don't have nothing to get anything from them. So also inflammation changes the cytokines, okay? They're also chemical messengers. They're the ones that make up our immune system. When something happens to the body, they're the ones to give signals, the proper signals to fight anything that defends our body, okay? So what happens? We don't have that signal anymore. Even if we have them, they're not going to the right place. Because you know why? There's so much inflammation going in the system. Our brain, the barrier to our brain, it's being eaten up slowly. I'm telling you, it takes years. Don't think that it's going to be a year, 2 years. I'll show you in the research that I'm going to show you. It takes 30 years, 25 years. So you can imagine how those toxins are eating us up alive, right? Little by little, okay? So these toxins, again, in the bloodstream, they destroy brain cells. Again, I say the lining of the brain barrier. As we have a leaky gut, we also have a leaky brain, okay? That's when the brain starts leaking. What is it leaking? It's not going to be leaking the brain. It's going to be leaking some nutrients, some neurons, and all those things. The receptors, we need receptors there so that when something is sent, we have something to receive, right? The receptors are being destroyed. And just to mention something, that's how we also get most of the autoimmune diseases. So the gut is inflamed, constipated. Let me ask you something. When we feel like our bone is so much inflamed, what do? We go to the doctor. We said, I think I have arthritis, right? Why? Because I feel it. When the doctor can diagnose you, the same thing with gout and all those things. When our stomach is being inflamed, we know that, right? Something is wrong. We have diarrhea and bloating and all these things. So we go to the doctor. The one thing about the brain is when the brain is inflamed, you won't even know it. You know why? We don't have pain receptors on the brain. You can feel pain when it's on the covering, on the bones, but not when inflammation is lingering around, destroying and destroying. You don't feel anything. God is so good, I tell you. God is such an amazing God. Can you imagine if we could have felt that inflammation on our brain? day after day, the agony of it. It reminds me of the verse in Isaiah chapter 45, verse 2. He said, I am the God, I'm the only God. He says, it goes like, I have girded you. I gird you, but you have not even known it. I have covered you, I have protected you, but you didn't even know that I've protected you. That's exactly what it is, inflammation. God has been protecting us so much. I can imagine what the brain will be screaming if we felt it. So when we have a good gut, we have a good brain, because everything the brain needs, it's delivered to him on time, same path, nothing destroys it. But then we have a bad gut, what happens? It starts leaking, everything goes into the system, starts destroying the brain, starts, manipulating the brain activities, the brain, the receptors, everything. So, my friends, this is, I said, a very simple topic, right? Very simple. I mean, I'm sure we know it all, it's just that we don't follow. But one thing I know is that when you have gut problems, don't think that it's just a simple thing. Not only that, let's make sure that we change the way we eat. I'll tell you why. They did a research. As I said, I have a lot of research, but I'm just going to be doing two. And I don't want to be reading the whole thing because I know my sister will be talking about it, because mine is just I took only the diet part. And the diet part, you can see, right, how depression, can you imagine how depression and anxiety, all those things from what I taught can happen? Because when my brain is saying that, you know what, I need dopamine, just send me a little bit of dopamine from the stomach, right? Or from whatever, the brain needs it, and we have it, really, we do have it. That's why if we didn't have enough, they will be just going crazy, all of us. And then the neurotransmitters started taking, the dopamine, whatever it needs to be on the brain. But what happens? It goes there, everything is inflamed. The cells are inflamed, the pathway is inflamed, so the dopamine or the serotonin is not delivered as it should be. So what happened? We're low in that. The anxiety, the depression, the mood swings, that really, really comes about it. But I want to read to you, this is a research they did in BMC Medicine. So what they did was that, let me just read you. It's very small, but I just want you to see how chronic systemic inflammation on the long run can destroy our brains, okay? So there has been substantial changes to diet habits globally over recent decades, wherein dietary patterns high in fiber, nutrients, dense food, omega-3, all these good foods have been replaced by diet higher in saturated fats and refined sugars. Whether diet quality contributes to physiopathology, particularly the common mental disorders, depression and anxiety, has been a focus of much recent research. Since 2009, there has been numerous studies reporting inverse association between diet quality and common mental disorders, both cross-sectionally and prospectively. Okay, it goes about, and then it says this association have also been shown in children and adolescents, and are notably concurrent across cultures. Individually, nutrients are also related to depression. An example, lower availability of, so one of the primary mechanisms of action proposed, they're talking about the research now, to explain this consistent relationship is that of inflammation, where diet quality can impact upon immune functioning and levels of systemic inflammation, which subsequently predisposed to depression. Data from population-based studies indicate an association between habitual diet quality and systemic inflammation. For example, in the Nurses' Healthy Study, a healthy dietary pattern characterized by higher intake of vegetables and fruits, whole grains, fish, and legumes were associated with reduced plasma concentrations of inflammatory markers, including inflammatory markers are, you go to the doctors, they take your blood and check if you have high level of inflammation or not. It's just a blood test. Unhealthy patterns, high in red and processed meats, refined carbohydrates, and other processed foods were associated with increased inflammatory markers. Western diet patterns were associated with higher levels of CRP in men participating in the health professionals follow-up study. So this shows us that, they've been researching since 2009, and what they're finding out is our Western diet is causing systemic inflammation, which causes depression and all those mental problems. And the last one is, this is a research they did, this research is called the ARIC study, okay? Excuse me. So in 2017, a consortium of scientists from high-profile institutes, the Johns Hopkins, the Bayer, and the Mayo Clinics, and some others, reported in the journal Neurology that high levels of inflammatory markers in the blood during midlife was associated with smaller brain volumes in life. These researchers documented baseline levels of inflammation in more than 1,600 men. So they took 1,600 men, okay? Men and women in their 50s. Then after 24 years, that's what I'm saying, this chronic inflammation is not a today or a tomorrow or a year, 2 years, 3 years, it's years. So after 24 years, the scientists measured not only how well the participants' brain were working, but with the help of MRI, because now we have MRI, right, so we can see everything. With the help of MRI technology, they measured volumes of certain brain regions associated with memory and Alzheimer's diseases. They measured, and what was discovered is that higher levels of inflammation in midlife were associated with significant brain shrinkage overall, with pronounced atrophy in the Alzheimer's-related area of the brain and the hippocampus by as much as 5% total shrinkage. 5% is a lot. Don't think that 5% is little, especially when I say 5%, because every time I think about percentage, I think about my money, right? So 5% is okay. But no, when it comes to the brain, it's a lot. So, and 5%, okay, furthermore, the number of words that an individual could recall were drastically reduced if that individual had higher levels of inflammatory markers 24 years ago. Can you imagine that? 24 years ago. If you had that high inflammation, systemic high inflammation 24 years ago, and they check you now, your chances of recalling when they test you right there is low. They're not even asking you to recall something to remember from years. It's like 10 minutes, and they don't even remember much of it. Okay, anyway, let me continue. So the verbal recall tests worked as follows, okay? A person were read a list of 10 words, not even a lot, 10 words. And then after several minutes was asked to remember as many words as possible. 10 words. It's very scary. I'm praying that I won't be in one of those statistics. I promise you, I'm praying. It was essentially a measure of short-term memory. But listen to this. The impact of this study are important because it means that the lifestyle we adopt when we were younger has a big role in determining our brain destiny when we are older. It is also important to note that the subject who had the worst results, were the youngest at the beginning of the study. Isn't that scary? If you have children, this is the time to change their life. Really, it's very, very scary. And then, so we are now focused to regard inflammation in a whole new light, okay? That's what they're saying. Far more than just the case of your painful knees and sore joints, it underpins the very precise process of brain degeneration. We also have come to learn that it may well be at the heart of another epidemic condition today, depression, which is now the #1 cause of disability worldwide, may not necessarily be due to chemical imbalances in the brain. It is inflammatory disease that roots in another imbalances throughout the body. Wow. And I truly believe it, because you know what? I just presented this in 20 minutes. But then if you sit and study it in depth, the systemic inflammatory, it's one of the scariest things you can imagine. And we can only get, as I said, mental wellness can be affected by so many things. But I can tell you the major of it It's what we put in our mouth. Because you know why? When we put it in our mouth, it's at least 3-4 times a day, right? It's every day, every day, every day. Chemical. Of course, we can have chemical toxin exposures to affect our brains, but it's not going to be every day unless we're right there by the exposure, right? But the food we eat, it's every day. You know what? This reminds me how the devil is fighting us with our brain, because the only way we can fight him, the only way, is through our brain. And that's why the Lord said in Proverbs chapter 5, I wish you just read the whole chapter. It tells us about our brain. That's why he warned us before. He said, my son, he said, thou, oh, I'm sorry. I think I got the wrong word. But this is what he said. He said, my son, forget not my laws, but in thine heart. What does he say? In thine heart, remember my commandments. In thine heart. He said, why? Then he gives us why. He said, for long length of days, long life. What is long life? It's longevity, right? Isn't that why we all strive for longevity? And then he said, peace shall all this be added to you. Peace. And then the second thing he says is, let me remember. Yeah, the second thing is, let not mercy and goodness, let not mercy and truth forsake thee. Mercy and truth is what we need today. Because you know what? It's because we don't have mercy with each other. Everybody's angry. Everybody's holding all those grudges, right? That's mental, by the way. It really affects us. And truth forsake thee. Truth is the one that's destroying the family. Truth is the one that's destroying the church. Truth is the one that's destroying the nation. All mental, right? And then you know what he says? Not only forget, bind them around your neck. Write them on the tablets of your heart. Heart means the heart has only one function, just pump blood. Heart is the brain. That's why the devil is fighting it, so that we'll not remember his word, so that we'll not, bounding it around our necks. And then you know what he goes and says? For, he says, you shall find what? Goodness, and what was the other word? You shall find goodness, you shall find favor and goodness among God and men. See, when we have favor towards each other, when we have goodness towards each other with God, isn't all the mental things taken care of, really? Absolutely. So, my friends, this is what I have today. Let not the devil fight us with what we eat. And then before I forget, if you go and read, I just read it recently and I was really amazed. If you go and read Temperance, the book Temperance, page 12, how it writes how the devil, literally it says, the devil called his angels to sit he had a conference with them. You know why he had a conference with them? A conference to destroy our food, to destroy our grains, so that, you know what? So that we have systemic inflammation, I promise you. That we will not have a good mind and will not be, will not have that connection with God. Because at the end, you know what the Lord says? He will come and he will write his name on our foreheads, right? So I pray that, we'll consider what I and all of us will consider what we eat. Thank you.
All right, Sister Monique. The microbiome, scientists are researching ways of transplanting microbiome from patients who are plant-based that have the good microbes into others, rather than teaching the patients how to create those good microbes. So thank you very much. Now I think we have the last speaker, and then we have brain food in the back for you, and we have a list also of food that you can consume to acquire good brain health. So I don't want anybody leaving. Just hang around and write your questions down. At the end of this presenter, we're going to have open mics. You can ask your questions, and then we're going to feed you some brain food. The next speaker, let me find, she sent me a very short bio. So Amoy is happily connected to the 4Ks in her lives. She's the daughter of the King of Heaven. She's the wife of Cain for the past 11 years. And she's the mother of 2 awesome sons, Kisan and Caleb. Amoy holds a Master's of Social Science degree and is passionate about empowering individuals and families towards biosocial and spiritual well-being. She currently serves as wellness coach and program director at Cooper Wellness and Disease Prevention Center. She also founded Family Blocks Ministry with programs airing on NCU radio twice weekly. Amoy likes to talk, she likes to sing, and she is learning to play the guitar, you said, right? So Amoy is going to be presenting the holistic approach to mental wellness. You've heard a lot of different mental problems. Where's the hope? She's going to bring you the hope. Amoy, the time is yours.
Thank you, Dr. Cooper. I am so happy to be here. Good evening, everyone. Okay, let me see if I understand how this works before I start. How does this work? Okay, awesome. Now, we have been sitting for a while listening to these lovely presenters. Unfortunately, I wasn't physically here from the beginning, but I was joining on YouTube. I was listening, and I've been so blessed and informed. But we've been sitting for too long, so we are going to stand. Dr. Louis, could you please get on the piano? And we are going to sing an accelerated version of Father Abraham. Okay? All right. Do you know that one, Dr. Father Abraham? Okay, awesome. All right. All right. Father Abraham had many sons. Many sons had Father Abraham, and I am one of them, and so are you. So let's just a little faster. Right hand, left hand. Father Abraham had many sons. Many sons had Father Abraham, and I am one of them, and so are you. So let's just praise the Lord. Right hand, left, right foot, left foot. Father Abraham had many sons. Many sons had Father Abraham, and I am one of them, and so are you. So let's just praise the Lord. Right hand, right foot, left foot, head up. Father Abraham had many sons. Many sons had Father Abraham, and I am one of them, and so are you. So let's just heads up, heads down, turn around. Father Abraham had many sons. Many sons had Father Abraham, and I am one of them, and so are you. So let's just right foot, heads up, heads out, turn around, sit down. Woo, you did great. How do you feel? Awesome, awesome, awesome. Okay, so we're talking about holistic mental wellness. And that means we're tackling this issue not from every angle, from your physical, your mental, your spiritual, okay? And we've already established that mental illness is pretty common. I think I heard another presenter say that already. 1 in 5 persons experiences some form of mental illness. So count off in this room, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. At least one of us is going through something, okay? And what is mental illness? These are health conditions involving changes in our emotion, or thinking, or behavior, so much so that it affects your capacity to function socially, to maintain your relationships in a healthy way, your work performance, your capacity to learn. Because we all have bad days, correct? We all have difficult, challenging moments, but then we're usually able to rebound somehow. But when we're mentally having mental illness, we find it much harder. 2 weeks, 3 weeks, 4 weeks, a month, a year, and we're still struggling. So that's what we're talking about. And what are the symptoms? We've talked about depression this evening. We've talked about anxiety. Also anger, especially prolonged anger. Unforgiveness. You know? Have you ever met someone and they're still talking about something that happened 20 years ago and they just can't get over it? Ruminating, that's another thing. Ruminating maybe on that same thing that happened, or having thoughts that we cannot seem to get rid of. You're demotivated, you're having trouble sleeping, or you're sleeping too much. You're worrying a lot, you're making very poor choices. Maybe there's addictions involved. You're overeating, you're undereating. These are all signs that you're mentally ill. And this is good information, because when we know this, then we can say, okay, I need to talk to my doctor, my psychiatrist, my counselor, my pastor. I need to contact somebody to network to see how I can address this. Now, the Bible says in Proverbs 17:32 that what? But the broken spirit dries up the bones. And the Bible just has so much truth in it. Did you know that chronic psychological stress is actually a risk factor for osteoporosis? Did you know that? So literally in the Bible it's telling us that when your spirit is broken, your bones are literally going to become like a sponge, huh? They're saying military veterans diagnosed with PTSD have a higher risk of developing osteoporosis, as does anybody else. Anyone that has been through trauma has a higher risk of developing osteoporosis than anyone else. And so the Bible is on point again, okay? All right? So negative thoughts, anger, unforgiveness, hate, that negative kind of mindset that we tend to have, it can lead us to overeat, it can lead to obesity, it can lead to hypertension, it can lead to cardiovascular disease and death. And I'm happy Sister Munit just talked about this, kind of explaining, because what happens when we have those negative thoughts over and over a period of time, your body goes into a state of chronic stress. And she just explained that so beautifully. So I'm not going to spend too long on it. But if you look here, you'll see it affects your brain. It affects the kinds of hormones that you're producing. You can't concentrate, you can't remember, you're depressed, you're anxious, your cardiovascular system is affected, you have high blood pressure, yes? Your joints and your muscles become affected, you have pain. Any of you who has pain, you've been going to the doctor, you've been taking tablets and you still have a lot of pain, go and check and see if is my thought process healthy, because that could be at the root of it. There could be some underlying emotional, mental thing that you need to work through in order to address that. Your immune system becomes affected. Sister Munit explained how that happened. Your skin, if you have a lot of dry skin, nails, brittle, that could be, chronic stress could be an explanation. Gut issues, reproductive issues. Chronic stress affects every system and every part of your body, okay? All right, so the relationship between your mind and your body is very, very intimate. I'm going to say it again a little bit later, but I want you to remember this. Now, we have to do some housekeeping. Before I get to the goodies, we have to do some housekeeping. Are you ready? So we have our broom out and we're getting rid of smoking. If you smoke, Smoking is one of those things that you really want to get rid of for many reasons. I know we have lots of doctors in here who can tell you cancer, cardiovascular disease, it's an underlying risk factor for so many things, but especially mental health as well. We have to put that on the list. Because when you smoke, you do have that release of dopamine, so you do feel good. That's good, right? Yeah, it's nice. You feel good. It helps you to cope with the stress, right? Okay, but the feeling goes away. And then when you continue to smoke, it tends to cause your brain to eventually stop creating dopamine on its own, because you're now becoming dependent on this external stimulation to produce it. And so smoking is a very bad habit to pick up, as is alcohol and substance abuse. The explanation is very similar, okay? It makes you feel happy at first, but it's going to alter your brain chemistry and how it functions. So we don't want to do that. If you're depressed, drinking alcohol is going to make it worse. Okay, so we want to stay away from these unhealthy habits, not to mention the fact that you're damaging your liver and all of these things. Caffeine as well. Now, caffeine is probably one of the most common drugs that people use. And remember that everything God creates has a purpose, okay? But we as humans tend to overuse and abuse things. Isn't that what we tend to do? We overuse and abuse these substances, and then we make ourselves unhealthy. So caffeine is a stimulant, and it stimulates production of adrenaline, and so it activates your fight or flight response. Now, you need adrenaline sometimes. If we need to run out of here, there's a fire, the alarm goes off, we need that adrenaline to kick in, and we run out of here. Am I correct? However, your body is not created to be in a constant state of fight or flight response. When you're in that state for a long period of time, you're damaging your body. And what we do when we drink lots of caffeinated beverages every day is we're putting ourselves in that state of stress over and over every day. Instead of training ourselves to adopt some healthy habits so we can have the energy to face the day, we rely on artificial sources. And when we're doing that, okay, and when we're doing that, we're damaging our body, okay, and it increases. And when you try, and you can know caffeine is a drug, because have you ever been around someone who's trying to quit? And what happens? They tremble, they have headaches, all these things. It's almost like you're coming off cocaine or something else, right? So it's something you really want to consider. Removing processed foods, Sister Munit talked about this already, okay? And it's a risk factor for depression when we consume lots of processed foods. And a diet in whole foods, and studies have proven this. I'm not just saying things off the top of my head. You can fact check everything that's on these slides, okay? A diet centered around whole foods is found to be protective against depression and anxiety. And processed foods do cause inflammation, as Sister Munit explained, and it's highly inflammatory. So I'm not going to spend too much time on that. So here is step number 1. I have 4 steps for you today. How many? 4 steps. Number 1, change your mind. You wonder what I mean by that? So I want you to change your mind. Romans 12 verse 2 says what? Don't copy the behavior and customs of this world, but let God do what? Transform you into a new person by what? Changing the way you think. Then you will learn to know God's will for you, which is good and pleasing and perfect. And I have a little video. I would like for you to watch this, and then we're going to talk.
Not so long ago, many scientists believed that the brain did not change after childhood, that it was hardwired and fixed by the time we became adults. Recent advances in only the last decade now tell us that this is simply not true. The brain can and does change throughout our lives. It is adaptable, like plastic. As neuroscientists call this neuroplasticity. How does neuroplasticity work? You think of your brain as a dynamic, connected power grid. There are billions of pathways or roads lighting up, specific way, practice a particular task, feel a specific emotion, we strengthen this road. It becomes easier for our brains to travel this pathway. Say we think about something differently, learn a new task, or choose a different emotion. We start carving out a new road. If we keep traveling that road, our brains begin to use this pathway more, and this new way of thinking, feeling, or doing becomes second nature. The old pathway gets used less and weakens. This process of rewiring your brain by making new connections and weakening old ones is neuroplasticity in action. The good news is that we all have the ability to learn and change by rewiring our brains. If you have ever changed a bad habit or thought about something differently, you have carved a new pathway in your brain and experienced neuroplasticity firsthand. With repeated and directed attention towards your desired change, you can rewire your brain.
All right. Awesome. So what do you think about that? God says, don't copy the behavior of this world, all the craziness, all the stress, all the anxiety, all the depression, all the rushing to and fro. Let me change the way that you think. Oh, I'm sorry, I don't mean to play it again. Can you skip it for me?
Not so long ago, many scientists believed that the brain
Okay, so yeah, as soon as he gets the next one up. So have you ever thought of your brain as being able to change? Like you can actually change the structure of your brain. You can change how your brain functions. When I learned about neuroplasticity, and it was just amazing to me. Dr. Warner Richards says that the mind is the creation of the brain at work. So your brain is the noun. Your brain is the physical thing that you can touch. That's the brain. And the mind is the action of the brain. It's a verb. It's your thought processes, right? So while your mind is churning, your brain is actually being produced. As you think, the structure and chemistry of your brain changes based on what you're thinking, based on what you're allowing in there. I love what Sister Dorca, Dr. Dorca was saying earlier. She felt, one of the things I have to do in order to manage anxiety about public is to do it more. What has she been doing? She has been creating a stronger neural pathway bent toward the habit that she has decided she wants to. She's practicing what she's preaching, what she's teaching. As a psychiatrist, she is intentionally moving toward that new thing that she wants to be normal and a habit and healthy for her. And so anything that you want to change in your life, in your mindset, in your thinking, it will take some intentionality at first, but you can do it. I like to think of it like the countryside. Anybody knows the country and we walk through the grass to go to somebody's house? Or maybe you have a pathway at home and you just walk across the grass so much that what happens? It's beaten down. You can see a trail there. I like to think of that neural pathway like that. And the more you walk on that path, the more established the path is. But if you decide, I'm not going to walk this way anymore, I'm not going to go that way, and you don't walk this way anymore, hardly at all, what's going to happen to that path? Eventually the grass is going to come up, it's going to disappear. Is it going to happen overnight? No, it will take some time, but eventually you'll look there and you'll be like, I used to do that? I used to think like that? No, that wasn't me. So as you think, that's kind of how it works in your brain. Okay, so brain chemistry does impact how you think, feel, and do. That is why persons are taking medications, because the psychiatrist, their doctor has recognized that their brain chemistry is off. So it impacts how you think, feel, and do, but what you think, feel, and do also impacts your brain chemistry. Now, what I don't want you to do is leave here and say that Sister Amoy says you can change your brain chemistry by what you think, feel, and do. And I'm not taking my meds anymore if you're on any anti-anxiety or antidepressants. But what I'm saying is you can work with your psychiatrist, your counselor, and you can establish some of the things we're going to talk about, and you may find with their guidance you can reduce or eliminate some of them. So don't stop your meds. They are helpful. They are useful tools that we have. But I want to show you some other things as well. The Bible says, whatever is true and honest and just and pure and lovely and of good report and virtuous and praiseworthy, think on these things, and your brain follows suit. So assess your thought life. So this is the first step. Assess your thought life. What are you thinking? I can't do it. It's too hard. Life is too hard. Life is not fair. What are you believing? What do you really believe? Do you believe that you're capable? Do you believe that things can work out? Do you have a positive outlook? Really assess what you believe. Do you think you're worthy? And you have to ask these thoughts because you have to ask the hard questions. Because if you discover, I really don't think I'm worthy, then you have to question it. Is it true? Is it noble? Is it praiseworthy? And then you have to adopt and repeat healthy thoughts. Life is hard, but it's not too hard. I can do all things through Christ who strengthens me. You repeat those positive affirmations. You ask yourself the questions and then you answer them. And you may need someone in your life to help you answer those questions, a counselor, a psychotherapist, a psychiatrist. But get yourself into that place where you can answer those hard questions. Am I making sense? All right, awesome. Holistic step number 2, we just did it. You have to move. You have to move. I've been in counseling before, so I'm not telling you anything that I don't do. And one of the first things my counselor said to me is, Amoy, do you go outside? Do you go outside? Do you move? Do you exercise? That's one of the number 1 treatments for any mental illness. You have to move. What did I say? Okay, good. I'm happy you're listening. So the relationship between the mind and the body is a very intimate one. It's not a mistake. I repeated the slide. Have you ever woken up in the morning and you just don't feel like yourself, but somehow either your sister, your daughter, somebody grabs you and you go outside and you just walk around, you do some gardening, you move your body. How do you normally feel when you're done? You feel better. When you move your body, you're actually having a positive impact on your brain. And there are many studies to talk about this. All right? Exercise boosts brain-derived neurotropic factor and endorphin production and helps balance moods, burn negative energy, and provides a feeling of well-being. Exercise is also going to help you to have a healthy weight and build muscle, and so you have a decreased risk of anxiety and depression. And you want to exercise at least 5 days a week for 30 minutes, okay? I like to say 6 days and take a Sabbath rest. I'm working on this, by the way. I don't exercise enough. So I'm working on this, but I do try to ensure that I get outside. What my counselor said to me is, Amoy, you must expose yourself to the sun every single day. Why? Vitamin D deficiency has been associated with mood disorders such as depression and anxiety. All right? So you need to get outside for 20 to 30 minutes and get your vitamin D levels. Let the sun touch your skin. That's how you are going to create that vitamin D. And it also increases serotonin. We've been talking about that happy hormone that helps you to sleep well and have a positive mood. So get outside, people. You can kill 2 birds with 1 stone. You can exercise outside. And you're getting your vitamin D, and you're getting your exercise, all right? Who's going to make sure they exercise every day? And don't tell me you don't have time. No, not everybody raised their hand. Don't tell me you don't have time, because we have time to do other things. The way you spend your time tells me what your priorities are. So if you don't have time to exercise, if you're too busy to move your body, you're just too busy. You need to drop something out. Drop something out of your life so you can have the time. Holistic step number 3, you have to nourish your body. Now, what is the optimal diet for human beings? You know, this is a question that is very controversial these days. If I ask you what's the optimal diet for a cat, what would you tell me? Grass. Well, I didn't know that. Okay, thank you. So we think of fish. If I ask you what's the optimal diet for a whale, you can tell me, right? Phytoplankton, right? Or a shark. But when it comes to us as human beings, we're confused. We have the keto diet, we have the carnivore diet, we have the whole food plant-based diet, we have the Atkins diet, we have the DASH diet. We're confused, right? So JAMA Network did a study on dietary patterns associated with all-cause mortality. So they have looked at different diets for us, and what they found is that the dietary patterns with lower all-cause mortality, that means death from all causes, they had, and this is 2021, they had a higher intake of what? Can you read it? Is it too small? A higher intake of what? Legumes, fruits, nuts, whole grains, non-refined grains, fish, and unsaturated vegetable oils. And these diets also had lower what? Lower or no animal products, red and processed meat, meat and meat products. I don't know why they repeat it, but it was intended. I copied it just as it is. High-fat dairy products, refined grains, and sweets. So of all the dietary patterns of eating that were lower in all-cause mortality, means if you eat this way, you're not going to die too quick. They had all these things in common, okay? And so what we want to recommend to you, oh, I'm sorry, I forgot that slide was next. So look at this and then look at this. Genesis 1:29. And God said what? Behold, I give you what? Every plant yielding seed that is on the face of the earth, and every tree with seed in its fruit, you shall have them for food. Does that sound a little bit like what JAMA Network just said? And God had given this to us when? From the beginning. Look at that. Look at God, okay? So God has given us what we need, and research is proving the Bible to be correct again. So nutritional deficiencies are seen in many patients with mood disorders, and if you're experiencing any kind of mood disorders, it's very likely that you're having some nutritional deficiencies. And they tend to be deficient in omega-3 fatty acids, in B vitamins, minerals, and amino acids, because these are precursors to the neurotransmitters you want. And there's also a significant association between low magnesium and depression and anxiety. So what do we want to do then to nourish our bodies? We want to reduce or exclude animal products. And why? One study showed that participants who removed meat, fish, poultry, and eggs improved their scores in just 2 weeks. Can you imagine? Just 2 weeks. And another reason is that animal products contain arachidonic acid. And this produces inflammatory compounds in your body and causes inflammation. So that's why we don't want to be eating too much. Most people who eat meat eat too much. So either you're going to get rid of it, or you're going to ensure that you're not having it every day. Your body takes a long time to work through it anyway. It's difficult for humans to digest. All right? So what we want you to focus on more is whole foods. Plant-based, a whole food plant-based diet, which has been proven to help with depression and anxiety because it's high in what? Antioxidants and also phytonutrients. And so we want to have more of that. Persons who are depressed or anxious could also do very well on a 2-week raw vegan diet. I don't really recommend anybody just live on a raw vegan diet, but just for a couple weeks, it could be good just to help your body to detox and to help your body to repair a little bit. You can do that, and then you want to continue with a high raw plant-based diet. Most of us eat a little bit too much of the cooked food, don't we? And not enough of the raw. And you could lightly steam your veggies sometimes. Some of us cook them too much. I want you to remember this. This is what has helped me a lot. You will feel like what you eat. How do you normally feel after you eat a bowl of pasta? You want to sleep. You're tired. Has that ever happened after you had a bowl of salad? Said no one ever, okay? So if you want to feel alive, eat living, fresh foods with vibrant colors. And that's how you're going to feel. You're going to feel alive, fresh, and vibrant. Who wants to feel alive, fresh, and vibrant? Me. And I am not very good with the raw foods. So what I started to do, and I started teaching others to do, is to do like a green smoothie in the mornings. I try to make sure I get that in the mornings. And please don't chug it down. Sip and allow yourself to masticate that thing before you swallow. But that's been helping me. I put like 2/3 of the blender in greens, a little bit of fruit to make it taste good, and I put my chia seeds and my soy milk, and I blend. You could add a little oats, and that is a good way to get in lots of good nutrition early in the day. You'll feel fueled, okay? And the chia seeds, as I mentioned, they are high in omega-3 fatty acids. And they recommend for those with depression and anxiety that they would have a 1/4 cup of flax or chia seeds every day. It's also a source of tryptophan, which is very effective for persons with depression and anxiety. And did you know, I didn't know this until a little while ago, that fruits and veggies also have omega-3. I grew up thinking that I had to get it from fish and fish oil. But I'm now realizing, and nuts and seeds, of course, but I'm now realizing, first I learned that blueberries had omega-3, especially the wild ones. I didn't know this. And learning also that green leafy vegetables, uncooked, also contain omega-3. And fruits like mangoes. I love mangoes. And jackfruit. Who loves jackfruit? Yes. Mangoes. Awesome. Awesome. And so you see the list there. So we want to do that. Magnesium is very important for you, especially if you're going through any kind of challenges with your mood, with your mental health. Magnesium-rich foods are like kale, spinach, chard, pumpkin seeds, and all of this. I won't read all of them. And you may have to supplement a little bit when you're just starting out. Even continuing, if you can find a good supplement to take, it's helpful. Sorry. Yeah, it's very helpful. So you may need to give yourself a jump start with a supplement, but then just continue eating the food. Food is medicine. Dr. Cooper always says, food is medicine, all right? B vitamins are also very important, and we tend to be low in those. And your leafy greens come up again, your legumes, if you're plant-based, nutritional yeast, and seaweed. And shiitake mushrooms are also sources of B12. People tend to think if you're plant-based, you may not be able to get. And B12, based on my understanding, the doctors can help, is that you don't need a lot, but you do need it. Okay, so don't ignore it. It's a micronutrient. Awesome. Turmeric is a very effective food to include in your diet. It's anti-inflammatory, and so curcumin is going to help to reduce inflammation. We talked about inflammation just now and oxidative stress. So that's one of the things you want to include. You can easily just make a tea. You can use it in cooking your beans, your rice, your curries. You can put it in your smoothie. And a teaspoon of turmeric boosts brain-derived neurotrophic factor, again, more than 50% within a month. A study has shown that. So this is something you want to include. If you can get it in raw, that's great. You can also have it cooked in your meals. It's the foundation of curry. Anybody likes curry? It's like one of the foundational spices in curry. So, some helpful herbs are lavender. And when we talk about holistic, we're talking about everything and all the senses. Aromatherapy is important too. How your place smells and feels and looks is very important for your mental health. Make your home cozy. When you get home from a long day, put on your diffuser and put some lavender oil in there. Some passion flower is good for sleep and anxiety. You can get that in some teas. Sage is also brain protecting and it enhances your cognition. You can drink that in tea as well. You can use it as a flavoring for your food. Chamomile is good to help you sleep and relax. It's an anti-anxiety herb. Rhodiola is good for energy. That's one I use in the mornings. It's good for anxiety and depression. Ginkgo biloba is also very good for anxiety, Alzheimer's, dementia, schizophrenia. I actually did not know ginkgo was good for Alzheimer's and dementia until recently, but I always knew it was good for memory and focus. It's been around for a long time. Now, I didn't include all herbs here. I think the ones I included are more safe than not. But I want you to make sure that you research and check with your doctor, especially if you're on drugs. For example, St. John's wort is one that I've known to be very effective for persons with depression. But I've also come to find it's contraindicated with a lot of drugs, statin drugs and so on. So if you are on any meds, especially, do your due diligence and check with your doctor before you. But I think most of these here are safe, but still do your due diligence, okay? Or if you're pregnant, there are some herbs that you don't, because herbs are powerful. Most of the drugs that are manufactured, they mimic the plant kingdom. It's just that they have it standardized for us. All right. Fasting is very important as well. As we nourish our bodies, what we eat is important, but when we eat is also important. If you are eating at 9 o'clock at night and then going to bed, you're going to wake up feeling like a hot mess. How many of you have experienced that? You eat late and then you wake up and how do you feel? A hot mess? Yes, you feel terrible. So you want to limit your eating to a certain time of day, hopefully 8 hours, an 8-hour window. And then you fast for the other 16. And when you fast, I mean, you can drink water, you can drink unsweetened tea and stuff like that. But don't be eating. And make sure your last meal of the day is lighter. Eat your heavier meals earlier on in the day. And eat your lighter meal later in the day. When you wake up in the morning, your body is rested and ready to break down some food. So the food you eat, if you eat the same meal in the morning or at night, your body is going to handle it much different, very different. It's going to handle it better in the morning. So eat your heavier foods in the morning. And intermittent fasting increases cognitive function, and it also boosts brain-derived neurotropic factors. That means you're going to have healthier neurons, and that helps you with anxiety and depression. All right? And I'm on my final step now, which is to restore. So can you remember them so far? Number 1 is change your, and number 2 is, and number 3, nourish. And number 4, restore. You must restore. You must sleep. You know, it's not a badge of honor to run around and say, I don't have any time to sleep. I don't have any time to eat properly. I'm so busy. And we think it's a badge of honor. Oh, this person is so busy. It's not. We have to take the time for rest and restoration. And when you sleep, you also make more BDNF, which when that is low, it causes you to develop mood disorders. Want to get into your bed by 10 o'clock at night so that you can get the best quality of sleep. Okay, you get a better quality sleep when you go to bed a bit earlier than later. And a lot of these slides, we could talk more about them, but we were just going to highlight, okay? Stress management. Be organized. Use your Google Calendar, use your planner, have a plan for your day. When you don't plan, you're scattered and you're stressed. We don't want to be stressed. We want to be organized. Approach your day in an organized way. And prune away the things in your life that are not helping you. You know, like when you have your plants at home and the leaves are dying, what you do? You cut them off, right? And there may be some things in your life. Pray and ask God to show you, what in my life do I need to, it's taking up too much of my time and I can't take care of myself. And you can get rid of them. All right? A healthy hobby. We're learning the piano. We're learning the guitar. We're doing all these things, right? We're taking up healthy hobbies. We're going for walks. We're volunteering. Did you know that when you give of yourself to others, it actually makes you happier? It helps you to produce more of those that serotonin and those happy hormones? Yes. So giving of yourself, volunteering is also a very good way to restore yourself. Take time to spend time in nature. Spend time in nature. Nature is restorative, just looking at green. I think God's favorite color is green. Do you? You agree with me? I think that's God's favorite color. Most of what he created is green. And studies have also shown that just getting out and looking around at nature, it just does something for you. It helps your eyes too, if you're on a computer all day, to go out and have a different focal point for your vision. And prayer and meditation, I put 3 stars because this one is so important. In one of my darkest seasons in my life, a couple of years ago, prayer is what saved me. I would set my phone to alarm every single hour to remind me to pray and give it to God. Because I would just worry about stuff. I didn't remember to pray. How many of you remember that God says pray without ceasing? How many of you know it, but do you remember it every day? No, we worry, we try to take on things by ourselves. So sometimes as we're trying to create new neural pathways, we have to be intentional. Set the phone to alarm. Keep a journal with you. Whatever you have to do to get yourself focused on God, to give it to him, to spend the time in scripture, to memorize your scripture of the day. You have to do that to restore yourself. Gratitude. My favorite author right now is Ann Voskamp. You can look for her book, 1,000 Gifts, Changed My Life. Give yourself a challenge to write down 1,000 gifts. I think I'm over time. I'm gonna wrap it up now. Just when you focus on gratitude, you change your outlook. If you try to write down 1,000 gifts, let me tell you what's going to happen. You're going to run out of all the big things: my car, my house, my daughter, my son, my spouse, my church, and then you're going to have to find more things, and then you're going to have to train yourself to look for. I love how that light looks in church. It made me feel good. I love her hairstyle. That was just really pretty how she looked today. I love how my son looks when he's concentrating on his homework, that look of, concentration. Someone gave me a flower today. Someone complimented my outfit. You write that down and you begin to retrain your mind to look for the good that's happening. Self-care, pedicure, manicure, whatever it is that self-care looks like for you, do it. And of course, we're here on our Sabbath. I don't have to explain the Sabbath to us, right? Not to this crowd. Okay? Set your life to music. Dr. Robert talked about this. Wake up in the morning, have your worship time, turn on some music, the hymns. I love happy, jazzy kind of music. And that will lower your stress hormones by 50%. Just putting your life to music, okay? And remember that no man is an island. Even as I work every day trying to help people with their health, I have to always remember the mental health. And just this week, I had to send someone for some deeper, because people, when we have trauma, sometimes we need somebody to help us work through that. So psychotherapy helps to provide that. Remember we spoke about the neuroplasticity? Sometimes we need that environment where we can go and somebody can pour into us a little bit so we can develop those healthier neural pathways in our brain, and then we can sustain change. So reach out or accept. Maybe somebody keeps calling you and checking on you and you keep ignoring the call. Accept the help if the person is trustworthy. Accept the help. And finally, laugh. Laugh. Life is not a funeral, people. Okay? Not all of life. Laughter relieves stress, it soothes tension, it builds immunity, it relieves pain, it improves your mood. Laughter encourages other people to laugh. Find a way to laugh. Laugh at yourself. And if you can't laugh at yourself, call me. I will laugh at you. All right? Laugh. And enjoy life, all right? Get a not joke book, something, but find a way to laugh every day. You're going to release lots of endorphins. So mental health is a state where your mind can be alert and focused, and you have the ability to learn and grow, and you're able to cope with the stresses of life. And that is what I want for you. All right? Thank you for listening. And I'll turn back over to Dr. Cooper.
Have you all been blessed? Oh, it is so great listening to healthcare providers that are Christian. the whole prospect, it's just a different perspective on things. It has been a blessing, and I want to go back a little bit to one of your slides where you place 3 stars in prayer and meditation. You know, and she talked about neuroplasticity, and scientists have shown that people who pray and meditate and have a high connection grow their brain. They have a larger frontal lobe. So, you know, Robert brought the brain here, and he talked a little bit about development from back to front. But if you really want to grow your brain, the Bible is so right. In Romans 12, verse 1 and 2, you can actually change your brain by connecting with the Creator. Studies, they can't really understand why people who really pray and go to church and or have a faith community change their brain, and that can be seen, as Munit mentioned, with the MRI. So we're open for question, and then we have some brain food at the back, and we have a sheet showing you the anti-inflammatory foods that are high in omega-3. We have to have a balance between omega-3 and omega-6. Omega-6 will cause more inflammation, and then we have more problem. And we have, of course, as everybody mentioned, plant-based whole food diet. We have all that outside for you, and at least you can take home to use to, start to develop healthier mental health. All right, so any questions? We have these capable presenters right here. We have the mics that are open. If you have questions, then this is the time for your questions. All right now. You have a question? That means the presenters did so well. Let's wait and see. Let me see, I think we have a question. Okay, we'll take a question from Mary Jane. Oh, did we take out the mic? Okay.
I heard about mushroom. They said the mushroom helps with brain development. So do you have what's your take in that?
Okay, so I'll answer, and I think somebody mentioned mushroom, but studies are showing certain chemicals in mushroom that produce brain health, that can improve memory, prevent Alzheimer's, decrease depression and anxiety. All right, we have to do some more studies. However, in certain countries, it is not really promoted. But yes, studies are going on right now showing that mushroom can improve health. All right, so I was listening to a doctor recently, Dr. Joel Foreman, and he himself, he has created supplement with this mushroom chemical. I really believe that you should consume the food rather, that's my belief now, rather than the pills. There are cases in which if you have, a deficit, it's good to take the supplement until you can really build up the store. All right, so I believe you should eat more of the whole food plant-based, and then there will be no need for supplements. Okay.
I was just double checking. I was reading about one called lion's mane mushroom in particular. So the shiitake one I mentioned was the one that they said has more B12. But in terms of mental health, the lion's mane mushroom, they said it's very good for anxiety, depression, ADHD. Studies have been showing that one is helpful.
Right, and then they're creating supplements, but just consume the mushrooms. Remember that you should eat a large variety of different foods, because different fruits have different, of course, micronutrients. All right, any other questions? Mary Jane has a question. Mary Kay.
Anyway, I was just
I heard Monique saying that the brain doesn't have any pain receptor, but why do we have headache?
She did mention, though, the lining of the brain have
Yeah,
pain
that's what I was
receptors. So that is why you will have headache. All right? But if you remove the lining, the actual brain matter really don't have the pain receptors. We have
It's the
receptors
brain.
in the spinal cord and so forth, and the covering,
It's just the membrane.
the membrane.
Okay, but the brain itself it doesn't have any pain.
What do you
pain
think, Doc?
receptor.
It's a very good question that you asked, but I want you to know that some brain surgery is done with the people awake because the brain doesn't have the brain receptors, and they need the people awake so that they can make sure they're in the right part before they do the surgery. Do you see what I'm saying? So yes, but you do bring up a good point, but yes, the actual brain matter does not have pain receptors.
Very good point. Anything else? Okay. You can use that mic, yeah.
Okay, hello. My name is Maria Esther or Mary Esther. And thank you so much. Oh, wow, I've been so blessed with what I have learned today. Wow, really blessed. Our town here in Mission has suffered from what was called the Superfund. And Superfund means we're a very contaminated, toxic town. And I was the activist who discovered all of that. We have a lot of mental illness in this town, and I think the city just got about $200,000 or $300,000, and the money was supposed to be used for all the people who suffer from mental illness. And I just invited the chief. I should have invited him and the mayor earlier because they go out of Mission to get instruction. I used to live in San Antonio. I'm a graduate of Incarnate Word, and I do have a degree in physical education and health. So everything you guys tapped on was tremendous. The problem is right now with all this mental illness and the COVID, we see a lot of citizens walking around without homes, without appropriate nutrition, with not appropriate housing, and it was very, very nice with what you all said. And I do want to thank this church because this church has helped so many citizens, especially with the food lines. And just you all's instruction, I'm very grateful and thankful.
Thank you so much, and thank you for coming. Yes, give her a hand.
Thank you so much for bringing that up. And I'm glad to see someone else from San Antonio. I worked for 7 years at Haven for Hope. That's where the homeless people in San Antonio are. I guess they try to build a program where they can get all their social services. And that's one of the things I realized, right? We're talking about all these foods, but they don't have the money for it. And even the food stamps that they got, then it's not even enough to get this stuff. And then now after COVID and the production issues and the transportation issues, food prices have gone up. So I have to consider that even in my treatment of the patient. So I try not to give them medications that require food for them to work. So you bring up a very interesting thing, and I'm glad you talked about it, because when we see people that are experiencing homelessness, we're why don't they get a job? Why don't they do this? They can't even. If you can't even feed yourself, right? How can you begin to do what you're saying, and get that mind connection with a higher power to say, I can raise myself above where I am, so it does start with food, and we should really consider that,
did just start a program with the Rio Grande Food Bank, and they are going to open the social services to try to accommodate. But this is one thing I keep saying, guys, I left Mission, Texas. I got educated. I was an athlete. I came back, like Governor Ann Richards said, you come back and you train and you teach. But when you're up against a lot of people who are not educated, or political people who focus on corruption, and, there were some comments made. I don't even go to Facebook anymore. We call it Chisme Book because it's all bickering and fighting. And the fighting I've been against the government putting Band-Aids, one of y'all said a Band-Aid on a hemorrhage. Once the body is so poisoned, so toxic, and you had some great points about what we ate, that's what's happening in Ohio. Here in Mission, Texas, we had to do what was called the biomarkers, the study of the hair, the blood, the skin. We had to go, 4 of us victims, guinea pigs. We went to Mexico because our own attorneys refused to spend the money on us. And then when the trains were derailing here in town, the ladies that were pregnant, I also do sign language, but the ladies who were pregnant, they lost their babies. And at that time, they didn't give you the fetus to bury it, they just disposed of it. And now, all the scientists I met, and James Harrington, and Dr. Rose with Cesar Chavez, it stays in the system for 100 years. And since we had the vegetables and the agriculture, we had to kill the pesticides who were destroying our agriculture, the vegetables. But, the same thing's happening out there in East Ohio. And it's not about what political party you belong to. It's about being a human being. Seeing my daddy died of cancer. Y'all hit so many things I have besides anxiety, depression, post-traumatic, thyroid cancer, my family, all cancer, spinal bifida. And once you start, getting into a big case, man, if we would have had educators like you all, oh my God. Educators like you all coming into community, because that's what we were begging. CDC, TCEQ, everybody, we were begging, do the studies, train us, tell us, relocate us. But anyway, thank you.
Thank you, Mary. Thank you so much. I'm going to take one more question, then I ask Pastor Brown to come. I want to thank all the presenters, Dr. Dorcas for traveling from San Antonio. We really appreciate it. Anthony, Amoy, Robert, Munit, we learned very well, and we are open to providing a seminar wherever you need us. Pastor Brown, can you come and close? And then we are going to open up to all the meat, the food we have, the brain food for you.
Thank you so much, Dr. Cooper. Thank you all for coming out this afternoon. Thank you to our speakers for coming. And I'm sure we've all been blessed, those that are online as well. And let us not just hear these things and let them pass through one ear and go through the other, but let us think on these things and work on these things so that with the power of God, our minds can be changed, our lives can be changed. And in our lives being changed, we'll change other lives as well. So let's stand as we pray. Our loving, dear, precious Heavenly Father, we're thankful that you have made us not as robots, but as human beings with feelings, thoughts, emotions. We pray, Lord, that as we have learned this evening about depression and mental illness and all that goes with it, we will grasp onto the positives and we will claim your power, because you have promised to give us power to overcome evil so that our minds can be transformed by the indwelling of the Holy Spirit. Guide our thoughts and our minds. Take us back to our different places safely. And may we continue to uphold truth, live truth, share truth until you come. In Jesus' name, amen. God bless you.